I remember covering this at the time, and the more I looked into it, the more I was like, this is unhinged. Bro, this guy's he's a Chud. He's a kook. He's a quack. What are you on about? I swear to God, a guy could come to the internet with one of those a turban on, chanting ancient Indian cantations and saying, whoa, I'm going, hello sir, I am going to the... Yo! Straight away, let's go! This is going to be so based. Dry smoke goes through the room. Ping pong, ding pong, ding tong, ping tong, ding tong, ding tang, tong, ting tong, ting tang, hurrah! If you don't know, I need to explain so you understand, and then we can go from there, okay? And I'm gonna, well, I'm obviously quite biased on the situation, but I'll do my best. God, do you know it's 2 years ago? This shit was 2 years ago, man. Yeah, I got 2 years of pent up Dr. K racism in the fucking tube, ready to fire, okay? Now, look, listen, okay? What it is, I'm just going to really cut to the chase because there's so much fucking drama that happened with this at the time. I had a much smaller channel back then. But if you want to go and look at it, all the videos are on my channel. Just search chudlogic Dr. K and you can go and watch the material about it, okay? But very long story short, okay? My personal interest in it was off the back of Dr. K, who is a streamer who's built his platform on talking to streamers about mental health issues, okay? There was like conversation and criticism of him that was being made by Mr. Girl. And through watching some of that coverage, I noticed that Dr. K was quite positively talking about something called Ayurveda. And that was my particular area of interest with the whole controversy and drama that was happening, right? So let me just put it to you like this, right? Ayurveda is an ancient Indian medicine, okay? We'll get to some of the things that Dr. K was saying about Ayurveda that I pointed out back then, right? Okay. But yeah, so Dr. K, basically, long story short, he is a psychiatrist who studied at Harvard, okay? He's got his own psychiatry practice, right? And if you look at his kind of material and stuff, interweaved into a lot of it is this thing called Ayurveda. Ayurveda is ancient Indian medicine, okay? It's... Well, I'll tell you what I'm going to do. Okay? I'm not going to tell you what Ayurveda is. I'm going to let Dr. K's Healthy Gamer wiki page explain what Ayurveda is, okay? And then we'll go from there. So this is still up on this Healthy Gamer wiki, okay? What is Ayurveda? Yeah, Twitch therapist guy. So he speaks to big streamers. He got kind of famous off the back of his conversation with like Rekful, and Rekful sadly ended up taking his own life. He's taken a step back from the kind of interviews with streamers, but he still does them from time to time. And another thing to note is apparently he's taken a step back from this Ayurveda shit, okay? But he's just done an interview where he's spoken about Ayurveda at length with someone, so we're going to watch that. And that is what has brought on this kind of renewed interest, okay? But Ayurveda is something that even if he's walked back from it, okay, that's good in a way, but it's still linked in with his private practice from what I can tell. Let me read this to you and you tell me what you think, okay? Ayurveda is traditional Indian medicine and differs from Western medicine in a couple of ways. Western medicine is about zooming in. It divides things into groups and goes through the various different types of illnesses you can have and whatnot. It divides medicine into lots of categories and people specialize in one category. We attempt to remove a lot of the individualities so that we can isolate the effect of the disease and the treatment. We treat depression and not the individuals, and we use randomization and controlling for variables to remove any individuality for the equation. Practically, this means that Western medicine, note the term Western medicine, is not about treating people, it's about treating disease. As a result, in Western medicine or allopathy, the gold standard is a randomized control trial. If you've trained in Western medicine, you may think of that as the best way, but as you learn clinical medicine, you begin to realize that people are fundamentally different. Dr. K, in his psychiatric practice, realized that even though antidepressants have a moderate improvement in the clinical trials for people, an individual may or may not get better by at all using them. There is a lot of individuality that enters medicine, and Western medicine does not factor that into clinical trials. Okay? Ayurveda is completely different to Western medicine. It is not about zooming in, it is about generating patterns from multiple data points. It looks at different dimensions of a person and makes correlations between their physical body and what goes on in their mind. It asks questions such as, is there some way that we can understand someone's bowel movements and how that will affect the mind? Is there a relationship between how prominent the veins on the back of the hand are and their mind? Is there a correlation between how cold their hands and feet get and their bowel movements? Is there a correlation between their mind and their skin? Ayurveda looks at lots of different dimensions of a person and tries to develop an overarching pattern that describes that individual. That's fundamentally different from Western medicine because in the latter, we try to break patterns apart and zoom in and understand individual elements. Ayurveda is not a rigorous definition of individual character, but rather it is a tool or framework for reflection and self or exploration, like astrology, 5-factor model or personality, or Myers-Briggs type indicator. However, Ayurveda is not just a personality framework, but also a framework that shows common identified traits or behavior that are related genetically. Ayurveda can have a multitude of applications that can even be used in the workplace or other environments for understanding conflict resolution. Western psychology assumes that human beings have the same psychology and leads to the study of different patterns of psychology. You know, it goes on and it kind of speaks the praises of Ayurveda. Okay? So you may be wondering, how do they determine these kind of different personality types and these different types of methods for treating individuals and stuff like that? Okay? I've got the answer here. Doshas. So what is a dosha? Well, let's get into it, shall we? Ayurveda is based on the idea of doshic balance, which is of the three major patterns that governs people's characteristics and mind called doshas. Every individual has a unique cognitive fingerprint, and different people have different kinds of cognitive fingerprint. There are three doshas in Ayurveda. One is vata, or wind. Two is pitta, or fire. And three is kapha, earth/water. So that's, and this isn't a joke. This isn't a fucking meme. This is genuinely what Dr. K is about. I'll show you his website in a second, show you even more. Okay? But this is something that he believes in and something that, in my opinion, he is trying to push to get kind of medicalized. And he's got links to organizations that are trying to do exactly that. Okay? And I remember covering this at the time, and the more I looked into it, because I don't know that much about it when I first looked into it, the more I was like, this is fucking unhinged. This is totally fucking insane. You know? How on earth is anyone taking this shit seriously? But some people did. And some people defended Dr. K to the ends of the earth over this stuff. You know, even to the point where they'd argue, like, well, he's not using it in actual practice. He's just, you know, all he's doing is using it as like a Christian might use it or something. Not true. False. Wrong. I've got multiple clips that I'm going to show you that demonstrate that that isn't what was happening at all. Okay? And he was not just using it for that, but he was actually making, you know, actual claims about medicine using this Ayurveda as a fucking basis for it. I had to dredge up the old document that I put together about this when I covered it before. Okay? I still defend Ayurvedic medicine. You can't ban me from your server this time. I mean, that's fine. You can defend as much as you like, but it's retarded, and that's that. I'm not looking to listen. I don't fucking bother banning people anymore. I don't really care that much. But this is crazy. This is totally fucking insane. You know, if you want to fucking, do some sort of wacky shit or something like that and want to do your fucking pseudoscientific nonsense, good luck to you, okay? But if you're like a psychiatrist and you're pushing this stuff, it's kind of crazy to me. You know, I put it in the same category as like a chiropractor or homeopathy or that sort of thing, you know? But yeah, I mean, what do you think, guys? Obviously, that's my opinion. That's my take. What do you think? If we look at people's physical bodies, we know that there are three types of people. There are people with very fast metabolisms who can eat whatever they want to and they will not gain a whole lot of weight. Then there are people with medium builds. Then there are people who are big boned. Vattas have fast metabolisms. Medium build people are pittas and big boned people are kaffas. There are also people who we call big boned. Wait, no. However, Vata and Kapha appear to be opposites, but they're actually independent from each other. In addition, each person has each dosha, but not all people are in the same doshic balance. These doshas are like stats in an RPG, where some people can have a certain dosha than another person, and therefore more inclined for certain roles or classes. But higher stats do not necessarily mean better outcomes in terms of doshic balance. To get a complete picture of your doshic balance, you should not look for an online quiz, but rather an Ayurvedic physician. Okay. Accredited psychiatrist recommending an Ayurvedic physician on his wiki page here, based, who will do a complete body mind analysis of your Ayurvedic makeup expressed through your genetic makeup. So yeah. Anyway, that just gives you a quick rundown. I mean, there's lots more here you can read through, but research. There's an emerging field called ergonomics. Researchers in this field took people of different prakriti, vata, pitta, kapha, and checked if there are any significant correlations between their genes and their doshas. There is a huge area of research emerging in Ayurveda. Wow. Oh my God, that's crazy, isn't it? A huge area of research emerging in this fucking pseudoscience shit, right? And would you believe it? Would you fucking believe it? Dr. K has got links to organizations that want to push exactly this. Isn't that crazy? So he wrote some article or some study, depressive subtypes of Ayurveda for the Ayurveda Journal of Health. And there's another organization. Which one was it? Oh, this is it here. Council of Ayurveda Research. Oh, the thing is wrong. Well, the website's not even fucking working now. Anyway, when it fucking pops up, it comes up in big letters, looking to fucking medicalize Ayurveda in the West or some shit. But yeah. Anyway, I'm obviously quite skeptical about this stuff. You can probably tell. I'm not really, into this shit. Gut flora is not a pseudoscience. So this is an example of something we can scientifically investigate. The Ayurvedic practice of looking at. Listen, Dr. K copers, keep coping. You're not worth engaging with. It's a waste of time. Okay, you're retarded. You're literally fucking retarded. And if there are parts of a certain practice that you can test and medicalize, then that just becomes a part of fucking medicine, doesn't it? That just becomes a part of medicine, and it's used as part of medicine. But Ayurveda, as a practice, as a principle, is not something that's been inherited in Western medicine because it's pseudoscientific, and some of the claims and some of the fucking ideas that come out of it are stupid and retarded. Yeah, but then the point, okay, If there's something that comes out of it, then take that and implement it into actual fucking medicine. You don't need Ayurveda to do that, do you? It's a complete waste of fucking time. Anyway, here's a couple of comments that this guy's made about Ayurveda.
Like, I shit you guys not. Like, I'm really not trying to toot my own horn, but there are people that are in my practice that have been on treatment for, like, have been in therapy and medication for anxiety for like 15 years. And within 6 months, we're taping them off of medication. They feel fantastic. Why? Is it because I'm a brilliant clinician? No, this is what I'm saying. I'm not actually any better. It's just I use tools that none of my colleagues use. I use Ayurveda.
So he was at least a very big proponent of Ayurveda. Now he has apparently walked back from it as part of this Healthy Gamer GG thing that he does, which is his project to help gamers on the internet, linked with Twitch, speaker to streamers, trying to help people out, give them counseling and shit like that, right? So this is kind of old stuff now. But the reason it's become relevant for me again is because he's done this interview about it. So I just wanted to refresh my memory. And if you didn't know, show you a couple of clips about this guy, because I want to see what he says in the interview and how it links up to the things that he used to say about it, you know?
We're going to take this big thing, and then we're going to take another thing over here like, diet preferences. Okay? And we're going to combine those two and see if we can come up with something even bigger. So this is how Ayurveda works. Ayurveda says, is there any correlation between someone's memory and the type of skin that they have? Is there any correlation between their mental, like cognitive fingerprint, like, and their weight? Is there any correlation between how constipated they are and how their heart functions? So what Ayurveda tries to do is it takes individual pieces and then it tries to construct patterns. And Western medicine does the opposite. It takes a whole thing, like when someone is sick, and it tries to divide them into its component pieces. So if you have an infection, you've got cough and you've got fever and you've got this and you've got this. Let's treat cough with this. Let's treat fever with this. Let's treat this with, the third symptom with the third thing. And so what happens is, like, over time, as people become sick in Western medicine, they have a lot of targeted treatments for each of their problems. So you've got 2 medications for your blood pressure, you've got 1 medication for your diabetes, you've got an asthma inhaler, and then you've got, like, physical therapy for your knees. And then you also take, like, Tylenol because you have arthritis. So over time, like what we do is we treat individual things. So we've got, like, a treatment here, a treatment here, a treatment here, and a treatment here. And so people end up with 4 treatments, right? This is how Western medicine works. What Ayurveda says is there any correlation between this? Is there a broad pattern that we can observe? And if there is that pattern, can we treat this and thereby improve this, and improve this? If we treat sort of the overarching pattern.
Also, I don't even think what he's saying is true either. That doctors just look at one individual thing. Like, he basically... He's like, oh God, I'm getting the fucking... He has got all of the fucking patter and all the speak of every fucking, like, pseudoscience shiller going. That's what was so crazy to me about this, right? Is this dude was pumping out the bullshit fucking alternate medicine takes that you hear from people like, what's that Indian guy called? What's his name? Gupta or something, is it? Deepak Chopra, yes. Shilling all the same bullshit as that. And people were like thinking this is all credible and correct. I was like, what? I lost my mind over this shit. I was like gaslit like crazy by people over this who were telling me this is all okay, this all makes sense, this is all fine. I was like, no, this is wrong. So I, did a video about it and spoke about it and put together some stuff. This is like 2 years ago now. And yeah, I mean, obviously didn't change anything or make any difference to anything, but it was, at least cathartic to get my thoughts out about, it. But, he's like, this is exactly what all these alternative medicine freaks sound like, Oh yeah, no, you don't understand Western medicine. Western medicine as well, Western medicine. There's medicine that works and medicine that doesn't fucking work, okay? That's it. This fucking Western medicine versus Eastern medicine shit is such cancer.
And we sort of address all of the components at the same time. And so what Ayurveda comes up with over here is something called doshas. So these are elemental balances. So what Ayurveda says is that people who are prone to ulcers are also prone to anger and irritability, and are also of medium build, and also tend to like lose their hair earlier than people who like so this is something called pitta. Okay, so like anyway, so pitta has some correlated physical and mental characteristics. Vata has some correlated physical and mental characteristics, and Kapha has some correlated physical and mental characteristics. And by improving the three doshas,
Western medicine is driven by the pharmaceutical industry. If it wasn't for the pharmaceutical industry, your retarded ass would be face down in a ditch fucking dead, okay? Or you'd be suffering with some sort of crippling pain for no fucking good reason. I absolutely despise these retarded takes from people about the pharmaceutical industry, okay? When the pharmaceutical industry is responsible for our long lives and our good health and the fact that we can survive conditions we would have died from at 30 hundreds of years ago. Yeah, smallpox, polio, like you guys are fucking retarded on this shit. It's crazy. Oh, but what about Big Pharma? Yeah, it's the reason you're still living and breathing now, you fucking moron, okay?
in and of themselves, you actually treat all of this like the component symptoms. And there's actually data that supports this. Okay?
It's just true. It's just true. It's just true that big pharmaceutical companies, for their faults, for their issues, and you can criticize them. I'm not saying you can't criticize them, but they are the medicine, the pursuit of science, all this stuff is the reason that we're living such long fucking healthy lives now. Well, healthy maybe not, but long lives at least.
Now we gotta do okay.
And we don't die from fucking cancer when we're 40 or some shit or some other fucking disorder.
Fix this. Okay, so this is what I did. So I gotta fix my...
These people are one step away from Owen Benjamin and drinking turpentine to get rid of the anus worms that make you have gay thoughts. What? That can't be real.
More space. So let's do this. So let's move these down. Okay. Uh-oh. There we go. Okay. Get that out of the way. Now, erase this. Let's fix this, okay? Now comes the tricky part. What is... Can Dr. K...
Okay. This fucking dude is writing out Vata air, Pitta fire, Kapha earth. These clips are still... I've not changed my opinion on this at all. These clips are still just as insane and absurd as when I first watched them. I think it's Yankoids are just brain broken when it comes to medicine sometimes. Not all of you, but some of you are so fucked by the fact that you need to pay for normal healthcare that you just go insane and just believe bullshit.
Two important caveats, which is one is that, like, it's not just a framework for introspection. That's how we're using it in these cases, absolutely. And it has all of the shortcomings of that. But it does appear that your Ayurvedic dosha actually correlates with genetics and other kinds of things, which were, I can go into more detail. But, even, for example, like some of my Ayurvedic colleagues in India have been able to predict complications of COVID based on the dosha of the patient. So COVID is one thing, right? But whether this person needs ICU stuff or they have cognitive stuff or they have GI symptoms from COVID appears to correlate with their Ayurvedic dosha, which is incredibly fascinating, right? So unfortunately, studies haven't really been published on this yet. We'll see if they ever kind of get published. But it does appear that, physicians are able to sort of predict, okay, does this person need to watch out for stroke? Does this person need to watch out for GI complications, cognitive complications, or respiratory complications? Because COVID can cause...
Bro, I remember watching this and being appalled. I'm like, what the fuck is this? And people were still defending it. People were still defending this shit. Bro, this guy's fucking, he's a Chud. He's a fucking kook. He's a quack. What are you on about? This is crazy.
All kinds of random crap in random people. But if you really think about it, I know it sounds kind of weird, but there's absolutely biology and science that leads to a complication of COVID. It's not random. It's not truly random, right? We just don't have an understanding of biology that's strong enough to where we can predict which kinds of complications are going to happen with which people in Western medicine. So it's really fascinating. Okay, so so this is also
Yeah, that's a classic.
asking, what do I think about homeopathy?
Now, this is a fucking doozy. This is one of my favorite ones, okay? So homeopathy, okay, is where you get a solution of something, some medicine or something, okay? Take a drop of it and you put it into water. You shake it up, okay? It dilutes it. And then you take a drop of that and you put that into something else and you shake it and it dilutes it further. And you do it again and again to the point where it's 1 part per million, right? So
okay, that's
it's just water.
But how do I make
it's literally
money
just fucking
off depressed
water
people?
with, in some cases, not even a single molecule of the substance that was originally in it because it's been diluted so much, okay? That's what homeopathy is, and that's used as a treatment, right? So it's not just the fucking Indians or other cultures that are pushing shitty medicine. That was invented by a German fella, okay? Complete fucking pseudoscientific bullshit. Let's see how Dr. K addresses that, shall we?
So I think homeopathy has less biological plausibility than Ayurveda.
Okay.
There's a reason why I chose to study Ayurveda instead of homeopathy. The clinical evidence is like mixed. I don't.
That's a complete bullshit statement. That's not true at all. It's not mixed. There is no good quality evidence anywhere that homeopathy is a thing. You're putting a fucking something into a solution with 1 part per million, not a single molecule left, and it's mixed apparently. It's mixed. He's full of shit. This guy, even if he's not shilling his own pseudoscientific bullshit, right? He's giving cover to another form of pseudoscience. It's unreal.
Don't put a whole lot of stock into it. It's kind of bizarre, but there is some clinical evidence behind it. But the scientific plausibility...
So, first of all, there's not. This is not true. There is no clinical evidence behind it. That's complete bullshit. And secondly, this idea that a doctor would sit there and say that when we're talking about... Bro, it's nuts. This guy is covering for homeopathy, which is a well-known pseudoscience, complete bullshit thing. Dude, I can't... This guy's unreal.
Is just really makes no sense, which doesn't mean that it isn't true. It could mean that we don't really understand as much, right? So for thousands of years, or like not thousands of years, but 60 years ago, medical professionals did not understand the mechanism. They didn't see a way in which meditation could be used as a treatment for depression. They didn't understand. I don't understand. Like, you have to talk to people's feelings to make them feel better. I don't understand how sitting down and chanting Om for 30 minutes is going to help someone's depression. There's no psychology. Freud would have been confused, right? Because he's like, where's the Oedipal complex? Where's the oral phase? Where's the anal phase? Where's the phallic phase? It's an understanding of these things and dealing with these issues that helps you.
It's also funny to think that this shit has existed for years. And if we just wait a little bit longer, all of a sudden, it's going to be clear to us and we're going to know it's all true and correct. You're talking about homeopathy, man. Homeopathy, even amongst alternative medicine, is like the joke treatment, okay? It's like the absurd concept of what it is.
Treat depression. How on earth could sitting there and chanting something for 30 minutes treat depression? So just because science does not understand something does not mean it is not real. It just means that we don't understand it, which is something that scientists tend to forget a lot, right? So there's like a camp of people who say that once something becomes verified, it becomes medicine, and therefore medicine is defined as what works. And if it is not medicine, then it is alternative medicine, and alternative medicine doesn't work. once you study something, once you study alternative medicine and you verify that it works, it becomes medicine. Therefore, medicine is defined by what works. So this is a common argument for people who are like kind of anti-alternative medicine, right? They're like, medicine is what works.
So this is the other dude. This guy, anti-alternative medicine. It's so crazy that this dude. I mean, I'm glad he's getting pressed now in this new interview which we're going to watch. And this guy that does it is a doctor, so hopefully it's good. I've not watched it yet. But the fact that this guy coasted along saying this shit. Also, do you know as well, right? The only reason that he stopped pushing this as part of this project is because apparently some people on his fucking subreddit posted stuff to say, yeah, this Ayurveda stuff is bullshit and doesn't have any evidence. And he backed down and said, okay, I won't talk about it that much doing this anymore.
And so my question is, if we go back 100 years...
I swear to God, a guy could come to the internet with one of those fucking turban on, okay, chanting ancient Indian cantations and saying, whoa, hello, sir, I am going to, you have cancer, I save you from cancer, come to me, I give Indian cantation and I heal your cancer. I heal your cancer with my cantation. And people on the internet would fucking defend it. People on the internet would go, oh yeah, that sounds true. Oh, he's from India. He must know what he's talking about. What's that? I'm a fucking dosha. Okay, give me the right cantation. Shim shalabim, shim shalabim, shim shalabim. Oh my God, I'm cured. Brilliant. Thank you. Thank you so much. And what they don't realize, they stopped their fucking chemotherapy, right? Don't fucking realise that was the thing that was actually helping them, but it took a while to kick in. They think the Indian cantations are the thing, so they stop the chemo, go to Mr. fucking Guru with his turban on the incantations, and then they die of cancer because that doesn't do anything. And that has actually happened, by the way. That is a thing that has happened, where people have stopped the treatment that actually fucking works, and they seek out alternative medicine. They're so retarded, they don't realise that that doesn't do anything, but they misattribute that to the getting better, because the chemotherapy eventually kicks in. But they stop that and then they die. Now, obviously, I'm not saying that Dr. K's doing that, okay? But I'm saying that if someone was to do that, some of you fuckers would buy into it because you're retarded.
And people were meditating for depression. Is it a part of medicine?
Yeah, that happened to Steve Jobs, didn't it? Didn't Steve Jobs get offered like treatment for his cancer? And he was like, no. I'm going to do a juice cleanse. Don't worry. I got a lovely little juice cleanse lined up. Did a juice cleanse. The cancer got worse. And then he tried to seek out treatment. I think he even got conventional treatment. And then he died anyway. Because it was too late and he died. Like, dude. It's just... This shit is crazy, man. I'm so opposed to this alternate medicine thing. I don't care if you want to seek out alternate medicine because you got a bit of pain, right? I don't really care that much about that, okay? Minor pain, I'm going to get some fucking acupuncture. Feel your boots. And apparently, on self-reported symptoms, like pain, like mild pain and stuff, it can have an impact because it's like a placebo type effect, right? You know, oh, that acupuncture's worked and it feels good. It doesn't necessarily do anything, but if you feel like it does, then what does it matter if it's a very minor condition, right? I'm not that bothered about that. But it shouldn't ever be a replacement for the shit that works, particularly for serious medical conditions, you know? Does he Well... this is why I want to watch this interview to see what he says about it, right?
Off depressed people.
$4.99 from M. Dr. K always seemed scammy to me.
Thank you for the $5.
Or not.
Because yeah, so he, you know, I don't think he promotes it as part of this. I think he still is a big promoter of it privately because he's still connected to these orgs according to his website. And I think he does have an interest in pushing this stuff at a, you know, a sort of level within medicine. I think there's some connection. I obviously was never able to like look into it in any detail to find out what it is, but I would guess that he's got some connection somewhere that makes it worth his while to talk about and be positive about Ayurveda stuff, you know? But I think from the healthy gamer stuff, I'm pretty sure the last couple of years, he hasn't really spoken about it. And in fact, this conversation is the first time that I'm aware that he's really mentioned it in any detail. So
we have no scientific evidence that it works. So then it's not a part of medicine, right? And then the question becomes, if it's not a part of medicine, did meditation help people with depression 100 years ago? And the answer to that question is yes.
But the thing is, I don't know much about the meditation aspect, but I would presume that it's not anything about the meditation specifically that does something. It's what's it called? Mindfulness, I think they call it, or something. But there's some aspect of meditation that enables you to relax or something like that, right? So it's one of those things that you can do that probably does have a benefit, and maybe there was a bit of resistance to it, but it's not just going or something like that does it. It's the aspect of impact it has on your mindset and body or whatever when you do it.
Which then means that alternative medicine works. So like the whole argument kind of falls apart. So this is where when we go back to homeopathy, like I don't see a whole lot of biological plausibility. I don't think that the evidence that I've seen for homeopathy is not as strong as it is for Ayurveda. Like,
this is, dude, there is no this guy is such a fucking dishonest hack, man. There is no fucking evidence for Ayurveda. There's no good evidence for Ayurveda. It's one of those situations where it's like, oh yeah, this Ayurvedic journal did a study about Ayurvedic practices, and it actually said Ayurveda is good. Wow, would you believe it? But if you go and look into it, yeah, there's no substantive trial or evidence.
How do I make money off depressed people?
Shows Ayurveda is any good. Hey, thank you very much for the $2. I did, yeah. I looked at the time. I did look. Obviously, I'm not a researcher or something like that, but with the knowledge or tools that I've got.
For example, ashwagandha is an Ayurvedic herb that has been shown to, clear beta amyloid, which is one of the things that causes dementia from the brain. And like Ayurvedic folks have been using ashwagandha for like neurological health and psychological health for thousands of years. And so we have like scientific verification of their methods. Whereas the problem with homeopathy, for those of you who don't know, is they like do serial dilutions. So what they do is like, I'm going to take like, a drop of ashwagandha and put it in 100 drops of water and shake it around. So dilute the ashwagandha to be like 1 part in 100. And then I'm going to take 1 drop of that solution and put it in another vial of water. So then it's going to be like 1 in 10,000. And then I'm going to take 1 drop of that dilute solution.
I mean, the thing is, at this point, he is being more skeptical. I think he's given way too much credence to it early on. At least he's given a bit more, some skepticism. But you notice it's all in the service of acting like Ayurveda is actually better, like significantly better than homeopathy.
And I'm going to put it in another solution. And then it's going to be like 1 part per million of the biological compound. And then they administer that as medicine. And
well, no, he doesn't have to say fuck that shit, but saying that the evidence on homeopathy is mixed is just not true. It's just not fucking true, right? I can't remember what it was I looked at. It was like something from the NHS. It was like, I think there was a study done in the NHS or a government study, and it was like, yeah, there's nothing of any substance here to prove any of this fucking works.
Claim that there's a therapeutic...
Which is obvious when you think about, like, okay, obviously you need a study to test stuff, okay, of course. But I feel like you can just invent some crazy thing and then be like, well, test it, see if it works, Because we're talking about, you get a substance, you put it in water, a drop of it in water, you shake it up and take a drop of that and put it in more water. You shake that up and take a drop of that and put that in more water. Do you see what I mean? It's like absurd on the face of it, isn't it? And the idea behind it is that water's got memory. I mean, it's just the idea that a doctor would talk about it and not be like, yeah, it's complete pseudoscience and there's no evidence whatsoever. But it's crazy to me that he's so moderate on a fucking obvious known pseudoscience that's, bro, okay, I'm getting, listen, this fucking gets me fired up, this shit, okay? Let's relax. And there's one more thing to show you after this.
So there are some trials that show that homeopathic remedies are effective. Like I've seen, homeopathic remedies for, I reviewed a paper about homeopathic remedies for a benign prostate hyperplasia, BPH. And it seemed like their stuff was effective. Like, people saw a reduction in symptoms and it seemed like it worked. It's just, I don't understand the biological plausibility. So I think
Doctor, by the way, Doctor.
The evidence is not as strong.
Dr. K.
I don't think that the biological plausibility is really there. So, Any tips for Pitta Kaphas? Yeah, so when it
Nocturnal Nick, you are just a massive retard and you're wasting your time and you're wasting your fucking breath. Why are you linking that to me? It agrees with what I'm saying. A few seem to show that homeopathy was effective, but only slightly. A majority showed that homeopathy had no therapeutic effect. That is not mixed. That's not mixed results, is it? How the fuck would you call that mixed? Fucking retard. That's not mixed at all. Okay, I think there's one more here.
Okay.
And the fact that these
So this is more just other crazy shit that you said. But listen, this dude here, okay, this dude is a hilarious story, okay? So this guy, off the back of speaking to Dr. K, came into the impression that he had schizophrenia. This guy's story was so funny. He was like a fucking acolyte for Dr. K. But yeah, after it, he spoke about how he thought he actually had schizophrenia or some shit. Literal schizo.
things are connected. That what I think affects my brain, which in turn affects the function of my immune system. And this is a really key point, because when we talk about healing or improvement, the other cool thing, which I think you've stumbled upon, is that if you want to make a biological change in your body, your mind is capable of doing that. And the really important thing to understand here is, I want everyone to really think about this, because it blows my fucking mind. You guys know in cancer, in clinical trials on cancer, what they do is they take two people with cancer, they take like 100 people with cancer, and they give 50 of them chemotherapy, which is drugs that travel in your body to cancer and kill cancerous cells. They give other 50 people, this isn't precisely true, but they give other people placebo.
This isn't precisely true. By the way, I looked at this at the time, and there are times where they'll use placebos in clinical trials for cancer drugs, but obviously it's not going to be in a situation, it's like to do with testing the efficacy of like another drug or something like that. This is all very off the top of my head. You need to go and look it up to see. But this narrative that he's spinning, which seems to suggest that they regularly use placebos in clinical trials for cancer treatment, is overstated, I would say. They sometimes do, but the kind of, because obviously you've got to be very careful if you're talking about treating cancer, because if you've got like someone with cancer, you don't want to give them a placebo if they need treatment, because you're not going to be treating the cancer, you know? So I think the placebo comes in at like some level, a minimal level, but like it's not nearly as common as he's making out. And as someone in chat pointed out, yeah, I think when I looked at it, it was like it's often like one drug versus another or something like that, rather than just, oh, here's a sugar pill, you know?
Placebo is not a real thing. It's like a sugar pill. And the interesting thing is that in these clinical trials, people who get, so when they determine the efficacy of the drug, well, the way they determine it is how much did it outperform placebo. That's the standard. It's not how much did it work, it's how much did it outperform placebo. Which means that if you look at a clinical trial in cancer, what's actually happening is there are people who are getting better, their cancer is shrinking on like MRIs, but they're not taking real medicine.
Okay.
So
That's, by the way, is complete bullshit. That's complete nonsense. Placebo can have an impact on self-reported things like pain. Okay. But when I looked at this before, this idea that cancer shrinks off of sheer brain power alone, it seemed like complete nonsense.
That is staggering.
Yeah.
Right? So this means that like placebo, and there's a really fascinating Ted Chuck, who has done a lot of placebo research. And the crazy thing that he's discovered is you can even give a placebo to someone and you can tell them, I am giving you a placebo. This is not real medicine. But I have this huge pile of evidence which shows that even if you take a placebo...
The placebo effect is real. But from everything I've seen about it, and obviously I'm not a doctor, I'm a layman. Okay? This guy's apparently a doctor, but he speaks a bunch of bullshit. It's about self-reported stuff. Like if you're in pain and you're given a placebo, you will report less pain, right? Something like that. But this narrative that through the sheer power of your mind, you can reduce the size of your cancer is absurd. And on top of that as well, it's like, yeah, correlation does not equal causation. It could be other fucking variables that are causing that to happen too.
Placebo, you will still get better. And do you know what happens when he gives those people placebo? And then he tells them, I believe that even though this is a sugar pill, I think that your rheumatoid arthritis is going to get better. Pewee, do you know what happens to those people when he gives them a sugar pill?
It gets better.
It does get better, even if they know it's a placebo.
Yeah. I'm not
like,
surprised.
That blows my fucking mind. Right? So now I'm getting off on a tangent because, like, what is placebo? Placebo is just all of the mechanisms of the human body and mind that we do not scientifically understand.
Exactly.
But placebo...
Just like massively I don't know. This is stuff, honestly. It's fine. Chat's behaving themselves. Chat, you're doing very well. Thank you. But I remember when I was looking at this stuff for the first time, there were some people that were like adamantly acting like this is all legit and correct and fine. And this is actually no problem at all.
Actually gets people better in cancer clinical trials, in rheumatoid arthritis clinical trials, depression clinical trials, but that's like waffly because depression is in the mind and it's not really real anyway. But you can look at physical illnesses like diabetes and stuff, and you can give people placebo and they actually get better.
Yeah.
It's mind-blowing.
It is.
So
yeah. Just give people with diabetes a placebo and you're good to go. Despite the fact that it's, I mean, I don't know. Yeah, depression's not real. I mean, dude, this guy's full of it. Like, I'm glad some people are being exposed to this for the first time, maybe, because this was like a little shitty interview on some shitter's channel. But this guy has been saying insane shit about things, and no one seems to care. No one seems to notice. No one seems to care. No one seems to be bothered about it. I mean, I obviously was a much smaller channel when I covered it, and my videos got like 30,000 views or something. But yeah, I was blown away when I saw this shit originally. And... I'm interested to see what the doctor's got to say. We'll get to that in a sec, but yeah.
What this means is that...
And by the way, this was me looking for like a week, probably. Looking at this for like a week or so, right? That's kind of my level of looking into this. And this is all the stuff I showed before. I'm certain that if someone was to dedicate like a lot more time to this, you could probably find more examples of the Ayurveda shit going on too,
In the same way that we can have an emotional attack that's going to affect your neurochemistry, affect your energy level, we can also do things on an emotional level that will bolster your physical self, your energetic self, your intellectual self. And we can also do emotional processing, which is what a lot of therapy is about, but we can also do something called jnana yoga, which is contemplation. So that's a little bit different from actually just processing someone's emotions. Both of them sort of happen in therapy, but in therapy, we don't really separate out the intellectual mind.
Anyway, there's probably more we could get to, but yeah. Placebo is a real phenomenon, and we don't understand at all what happens, but it has a true 50% efficient efficacy rate. You're retarded. At what? At what? What do you... People hear placebo effect and they think it's like a fucking miracle, okay? And they think it's a miracle that can cure a bunch of shit like this guy's talking about. But it's not true. It's not fucking true that it's this miracle, okay, that you could have a disorder or a problem and you could have a placebo and it will treat it or something like that, right? There's certain limited places where, yes, it will have a positive impact, but it doesn't mean that we should put that at the forefront of our medicine and be like, well, let's fucking do placebos instead of all this medicine shit. Imagine pretending you were administering your patient's medication for cancer, but it was actually a placebo sugar pill and you send them into a diabetic coma instead. So anyway, hopefully, if you weren't convinced before, you now see what I was coming from when I said this shit was insane when I covered this originally. And if not, I mean, you're fucking hopeless at this point.
Versus...
Anyway, the whole reason I've watched all of that and got you up to speed with the stuff that I was concerned about before is because of this. So this guy, Dr. Mike, actually interviewed this guy about the Ayurveda stuff. And I was kind of interested to see, is he going to kind of like talk about this? Is he going to be upfront about what he thinks? Is he going to say all this shit to him, to this doctor? Because my guess is that he's going to kind of obfuscate a bit and kind of dance away from it. Now he's speaking to an actual fucking professional who probably thinks it's a bunch of nonsense, you know? So let's find out.
Hysteria in women. Like, very judgmental, very culturally based at that time. You're saying that didn't exist 5,000 years ago?
No. So, dude, the East and West are completely different, man. Like, it's like night and day.
Okay.
So let me just give you a couple of examples. So, like, if you look at an Ayurvedic textbook, they had a super cool diagnosis for diabetes.
Okay.
They say, go pee next to an anthill. If the ants drink your urine, then you're diabetic. Okay. Right? So they had a lot of understanding of
Yeah, sounds fucking... Yeah, let's go! Oh, the ants are wandering towards your piss. Take this insulin now.
physiology.
What did diabetes mean to them? Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range. But if I'm trying...
Wait, hang on a sec. The doctor's about to own him.
Next to an anthill. If the ants drink your urine, then you're diabetic. Okay. Right? So they had a lot of understanding of physiology.
What did diabetes mean to them? Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range. But if I'm trying to put myself in their shoes, I have no measurements of that. I'm not even aware of bacteria, right? Antibiotics don't exist.
I don't know. I think they have certain herbs that have...
Yo! Straight away! Let's go! This is going to be so based. Oh my god, this is going to be so based. Bro!
A1C and seeing it fall in a specific... Because to me,
they say, go pee next to an anthill. If the ants drink your urine, then you're diabetic. Okay. Right? So they had a lot of understanding of physiology.
What did diabetes mean to them? Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range. But if I'm trying to put myself in their shoes, I have no measurements of that. I'm not even aware of bacteria, right? Antibiotics don't exist.
Yo!
I don't know. I think they have certain herbs that have antimicrobial properties. They understand the process of sterilization. So I think they
do?
Oh, yeah.
I mean, we just did a video on the history of the first gentleman who recommended washing hands in between treating morgue patients and delivering babies.
Hey, I know about that. Oh, what's it? He's called like Schlebelbez. What's the guy's that he's like? Yeah, I remember that. I've looked at this. This is a really interesting story. There was this doctor who was like, listen, I'm noticing that when we're treating corpses, they didn't wash their hands back then, and then we're going to deliver a baby and the baby's getting sick. What's going on? And this guy was like, I think we should start washing our hands because I reckon there's germs. And the guy was like slated at the time. The guy was slated. He was like, he died in like, without his role being credited because people thought he was crazy. And then afterwards, everyone was like, oh, actually, yeah, he had a point. Fuck, this actually works. And then everyone now, obviously, doctors wash their hands between everything they ever do, you know? Oh, it's a really interesting story. I'm glad this guy brought that up. What's his name? Yes, it's Semmelweis. That's it. Close enough. Yeah, the Semmelweis guy. That's the guy, yeah.
That's in the 1800s. When was that? 1850s, yeah.
I mean, so I may have a rose-tinted glasses when I look at Eastern medicine. I don't think Eastern medicine is perfect by any means, but they absolutely, like, dude, like, so even if you look at in Indian culture, this is how well they understood microbiology. So in Indian culture, we eat with our hands, right? Mm-hmm. Okay. So, you know, we also don't have toilet paper. Mm-hmm. So anytime...
I don't know that, actually.
So, like, if you look at, like, ancient India, like, I'm just, you know, toilet paper is a relic.
Let's be real, he's not really helping the Indian perception, is he here? But anyway, I'm not going to be racist, okay?
relatively recent invention.
Of course.
So how did people in India clean themselves after having a bowel movement? They would wash with their hands. So and then this is how well they understood microbiology. You never eat with your left hand. You always eat with your right hand, and you always wash with your left hand.
That's funny to me because you view that as like them practicing microbiology. I view that as them stereotyping and being rude to people who are left-handed. No, I'm just saying.
Yeah, no, I mean, but there's a
like
reason.
they were aware of the bacteria, but they weren't aware that some people prefer to use the other hand.
They were absolutely aware that there were left-handed people.
Okay.
What they realized is, I don't care if you're left-handed, there needs to be a convention where bacteria that come out of your ass should not be put in your mouth.
Sure.
And that is more important than the handedness, because they literally lived in a society where there were endemic diseases like cholera and stuff like that. So for the sake of sanitation, they would always have you eat with one.
Okay, I'm going to be... Don't eat with your shit hand. Okay. Don't eat with your shit hand, guys. There we go. Microbiology understood level is increased. Don't eat with your shit hand. Oh, is this guy real, bro?
One hand, and you never use this hand. And this is your washing hand, and these are completely separate. So one hand touches the back of the GI tract, and one hand touches
the masters of sterilization. We use this hand to wipe our ass, and this hand to eat. Microbiology unlocked. Like in fucking, what is it? Civilization. Microbiology understanding has been unlocked. Wipe shit with the left, eat with the right. Boom. I can tell this is going to be good already.
The front. So they had an understanding of microbiology in that way. I don't know.
Well, was it microbiology, or did they just see cause and effect?
Probably more of cause and effect than microbiology, because this is where they also develop something very similar to the theory of humors. So they have like these concepts of elements. But the really interesting thing is that what they basically, I think what they did is notice all kinds of correlations and then developed a heuristic system to explain those correlations.
My question is now, is this a radical form of survivorship bias where we're remembering the ones that turned out to be right?
But how do I make money off depressed people?
Yeah, that's another point as well. Thank you for the $100. Could it just be that they learned that if they ate with the hand they wiped with, there would be little shit bits on their hand and it would taste bad? I've never eaten shit before, okay, to be clear. But having watched the video of that JMAA guy do it, it seems pretty clear that it was very unpleasant in doing so. So I'd presume that in doing so, you'd probably recognize it tastes bad. And yeah, also cause and effect. It could be that you recognize that that made you sick. So that's why you did that. I think we're given a lot of grace to call that understanding microbiology, okay?
Are not pointing out the hundreds of correlations that they deemed as cause and effect. And they were magically wrong. Like,
it could be. So
wait, hang on. Now, the question is now, is this a radical form of survivorship bias where we're remembering the ones that turned out to be right and are not pointing out the hundreds of correlations that they deemed as cause and effect, and they were magically wrong? Like,
it could be. So now let's get into that. This is great. Okay, so let's look at that in a couple of different ways. So it's absolutely a possibility of survivorship bias. So let's also remember that there are a lot of things in Ayurvedic medicine that are not correct, right? So this is where, and what tends to happen is we don't propagate those. So, and then what ends up happening is a survivorship bias where the stuff from Ayurvedic medicine, like let's say ashwagandha or brahmi or meditation, these are the things that we now associate because we remove things like heavy metals in the usage of medicine. So there's something called Rasa Shastra, in which they'll use things like arsenic, mercury, things like that as treatment. But that is not nearly as popular, but that's absolutely a part of Ayurvedic medicine. So to say that Ayurvedic medicine is right, I think...
By the way, saying that's not nearly as popular, that is cope. That is cope. Because in some parts in India, particularly rural areas, they still do that shit. And the Indian government has had to make efforts to try and, stop the Ayurvedic shit and, draw a line and try and move away from some of these like old wives' tales that we would call them. But in India, that's their medicine. Oh, you got indigestion? Drink some fucking mercury. That'll sort that right out. No problem,
think is a gross overgeneralization because there are 8 branches of Ayurvedic medicine. Some of them have scientific support. Some of them have scientific evidence that they're actually harmful. Now, there's even a counter argument to that, which
also, if there's stuff out there to look at that demonstrates that there is I just don't think that's true. I don't think it's true. I think that there's some practices. That might even be being too generous. What practices have actually come out of Ayurvedic medicine, Like, what actual practices have we pulled out from it and implemented in Western medicine? Well, I mean, we got toilet paper over here, so not the fucking left hand, right hand shitting thing, that's for sure. But I just don't think, like, people that support alternative medicine make this argument about, oh, well, you just inherit it in your own medicine, okay? And that's true. In some cases that happens, but, you know, what has actually come out of it that we would look at and go, well, that's got its roots in Ayurveda. When I looked at it before, the only thing that I can think of is there was one thing about, what was it, nasal, putting fucking shit up your nose to clear your nasal passage or something. I think that's one thing that apparently has got its roots in Ayurveda. How come you aren't covering the FISA debate? Because I don't know what that is.
Which is that they may have known something about the usage of these chemicals that we don't. So a good example of this is if you go back 60 years ago and someone shows up and says, hey, you don't need to take an SSRI for your mental illness. You can sit there and meditate. And what would science have said 60 years ago about meditation?
That it's useless.
Absolutely, right? And that's what we did say. And so they figured something out that, based on our modern understanding of biology at the time, was literally useless, was so antithetical to everything.
Okay, even if we accepted this, so they've got one... Why? Keeps bringing up meditation, doesn't he? Keeps bringing up fucking meditation. Okay, you got meditation. Let's say we grant that completely. Okay? Let's stack that up against Western medicine and see what's in Western medicine. And it's like a fucking whole list of shit, you know?
That there was a revolution in biological psychiatry. We're like, this is complete BS. And we were so confident. And today it turns out that
SSRIs are bullshit. I hear that a lot. Is that... I don't know, man. I don't, that's too... Most drugs are BS. I don't know if I agree with that. SSRIs barely beat placebos. Is that true? Yeah, I think Stylo. Listen, I reckon Stylo's right. Overprescribed. I don't think they're bullshit, but yeah, I can easily imagine they get prescribed to excess. What I'd say with SSRIs is that there probably are other things that may help, but people are just put on SSRIs, whereas you could have more other types of treatment and stuff that might be beneficial, you know?
we're grossly wrong about meditation.
Yes. But again, are we just pointing out the one time we were wrong and we were actually right the huge majority of the time?
Wonderful.
That is what I think
But
makes
how do I
Western
make
medicine the
money
best. So
off
what makes
depressed
Western
people?
medicine the
Sorry,
best
but
is
when
we're
it
the
comes to
best
street
at...
shitters, the smell alone tells me.
Thank
Ayurveda
you.
Not trusting you with my credit card info. Know what I mean, lads?
Thank you for the 333.
Are we just pointing?
It turns out that we're grossly wrong about meditation.
Yes. But again, are we just pointing out the one time we were wrong and we were actually right the huge majority of the time?
Oh my God, I literally just said that. Yes, me and this doctor guy, he's obviously smart and I'm a retard, but fuck me, exactly that. It's exactly that.
Makes Western medicine the best. So what makes Western medicine the best is we are the best at pointing out when we're wrong. That's what makes it.
But that's a scientific method, is it not?
Sure.
That's
so
why
I think
people were mad during COVID that guidelines changed. And it's like, well, because we were pointing out when we were wrong.
So yeah, that's the scientific method. So I think this is the weakness. I was I helped organize a conference at Harvard a couple of years ago, and one of my mentors was on the panel. And so this is a conference on integrated medicine. So there were a bunch of like Eastern medical practitioners there, and they kind of asked this question. They said, like, what do you think needs to happen for Eastern medicine to be more...
Oh my God, fucking dry smoke goes through the room. Ping pong, ding pong, ding tong, ping tong, ding tong, ding tang, tong, ting tong, ting tang, hurrah! Oh my God, dude.
more widely accepted. And my mentor, brilliant, got on integrated medicine. So there were a bunch of like Eastern medical practitioners there, and they kind of asked this
Or as we call them in the West, doctors. Just doctors, you know?
question. They said, like, what do you think needs to happen for Eastern medicine to be more widely accepted? And my mentor, brilliant guy named John Denninger, said, you guys need to let your treatments fail. The problem is there's such a pissing contest between Western medicine and Eastern medical practitioners that no one on the East is...
Oh my God, dude. How do people like this guy? It's unreal.
Willing to say, yeah, this treatment sucks. So the one thing that we do really, really well, which is I think why allopathic medicine, talking about selection biases, but let's talk about not selection biases the reason that Western medicine is dominated so much is because we are so good at pointing out when our medicine is wrong. So if you look at things like thalidomide or, like that's such a great example. Oh my God, revolutionary medicine solves nausea. And by the way, we're never going to use it ever again, right? And so
with thalidomide, am I correct in saying that the FDA didn't approve that in America? Is that right? Because in the UK, you don't see them as much anymore. But you did used to see, when I was younger, you did see the little, like, ooh, like no arms and that. And you're like, what the fuck? And yeah, you're like, you find out. I must have been like 10 or 11 at the time. And I was like, what is wrong with that person? And then my mother explained it to me about thalidomide. And I think that by the time she was pregnant with me, that it kind of ended. But I don't know how slim the margin was, where I could have been a fucking thalidomide kid, maybe. And I'd be sat here with no arms or something.
Welcome to Chud Nation.
But yeah. Hey, thank you for the sub. Appreciate it. But the thing is with thalidomide is, I think that is like a failing of something. Because the FDA... Right, I'm correcting this, aren't I? The FDA never approved it. They said that it was, too untested or something. And then it didn't go through, did it? Anyway, sorry.
So if you look at things like thalidomide or, like that's such a great example of, oh my God, revolutionary medicine solves nausea. And by the way, we're never going to use it ever again, right? And so we're really good at that. And the biggest problem in Eastern medicine is they are so hung up on getting widespread acceptance. There's this ego battle going on between Eastern medical practitioners and Western medical practitioners that Eastern medical practitioners are not willing to say, oh, hey, by the way, this treatment actually sucks.
Is that because...
In my opinion,
wow.
Chud, Britannia left that shit country too early. You only influenced them halfway. Should still be under the empire. Return India back under British rule.
Because they're ideologically driven. If you were an Ayurvedic practitioner, okay, or you were a homeopathic practitioner, why on earth are you going to say, yeah, this thing I push sucks? Like, you're not going to say that, are you? You've literally got a vested interest in saying that it works. You know? And listen, I'm not saying that problem doesn't exist in Western medicine, okay? Of course, there are issues with that, okay? But at least there's some standard or principle set up that ideally helps to stop and alleviate these problems. And, I think there's some mechanisms that at least try and limit that. Whereas if you're an Ayurvedic practitioner, all of the fucking Ayurvedic organizations all push the idea that Ayurveda works, and you push the idea that it works too. So, you're far less likely to say, well, this doesn't work, Whereas if you're just generically a doctor, but yeah. 2023. What's this? Look, I'm not doing a fucking study off thing, okay? Like, you cannot just look at a study and go, right, that's that. There's so much other shit going on with it.
A lot of those treatments are less based on the scientific method and are more culturally based?
So I think they're based on the scientific method, but they don't look at the mechanism in the same way that we do. So if we look at scientific method, what is scientific method? It is having a hypothesis, testing that hypothesis, observing results. So I think they did that. That's not how meditation was developed, which is a whole different conversation about sources of transcendental knowledge and all this good stuff. But they absolutely applied the scientific method. So I don't think that you can develop as robust of a system of medicine. The big difference, though, is that we're really good at instrumentation. So in the West, it's not even technically a part of the scientific method. You can just, a child can make observations, test hypotheses, and come up with conclusions.
I mean, every time a child's learning to walk, that's what they're
absolutely
doing.
Right. But they don't use a microscope. They don't understand anything about anatomy. So one of the things that I think we've actually mistaken is that in the East, they use the scientific method quite robustly. They just don't use instrumentation. So what they did is figured out all of these correlations and causations and developed these kind of heuristic systems. Even something like the concept of an organ is actually an abstract concept, right? It's not, you can make an argument that there's no such thing as an organ. There's just, everything is just cells.
You can just say that about anything, about a cell.
Oh my God, dude. That feels like close to the fucking Vosh moment to me. The Aqua moment, honestly.
Yeah, right?
That's like, I I think like Deepak Chopra's main thing is like, what is HIV?
Oh.
That's a concept that you've created in your mind. It's like, well, wait, hold on a second.
Yeah, so I'm not.
I think
quite
it's very
there.
easy to go.
So I think they applied the scientific method, but what they didn't have was good instrumentation to elucidate the mechanisms.
Okay, that's
Right, so they
wonderful.
didn't have
But how do I
microscopes.
make
They didn't have, but they were
money
still
off
able to make
depressed people?
observations
5 Canadian
that when you
dollars
have a
from
diabetic.
PD.
Hey!
Hashtag Wisest paid 7 for India food prep video.
Thank you for the super chat.
Shorts commentary. Dr. K wouldn't even eat it. What a scammer.
They're going to have sugar in the urine, and if you have sugar in the urine, you can test for that by if ants drink your urine.
Right. I think a lot of their scientific method approach is more so finding correlations and things that happen, which can be a form of scientific method and an introductory form of scientific method. But then in order to see if your correlation is valuable, can you affect it? Can you reproduce it? Can you generalize it? That is always missing.
In Eastern medicine?
Yeah.
I disagree.
Really? So
yeah,
tell me more
yeah,
about
so
that.
like, I mean, that's how they came up with these things like ashwagandha and brahmi and some of these things that we
Yeah, exactly. Doc. I need to call you Dr. K, DK. It's all well and good to be able to do that, but they probably have got tons of false diagnoses. Exactly, because there's not the rigor and the fucking, repeatable method of doing it. Dr. DK.
use in psychiatry, turmeric. So for example,
How on earth can you disagree with that, by the way? Like, dude, this doctor's based. I'm glad he's taking
See if your
task.
correlation is valuable. Can you affect it? Can you reproduce it? Can you generalize it? That is always missing.
in Eastern medicine?
Yeah.
I disagree.
Really? So
yeah,
tell me more
yeah,
about
so
that.
like, I mean, that's how they came up with these things like ashwagandha and brahmi and some of these things that we use in psychiatry, turmeric. So for example, the usage of bitter herbs in the treatment of diabetes. So what they did is, I think, right, so I wasn't there, you just have these texts where they'll say, okay, if you've got someone who's a diabetic, they need to eat bitter melon. So I think what they discovered is that when you feed someone a food that has an impact on their insulin metabolism, has an impact on their blood sugar, once this person eats bitter melon twice a day or drinks the juice of a bitter melon on a daily basis, the amount of sugar in the urine that the ants get attracted to goes down. They'll even taste urine to detect the sugar content.
Right. Pissed by that anthill. Oh, have some of this bitter shit and this shit. Right, pissed by the anthill again. Oh, the ants they're not quite as keen this time round, so I reckon you're better. Wasn't diabetes also like a completely destructive condition, and it was only the kind of like conception and what is it, the idea, insulin, the creation of insulin or something like that is the big step forward that allowed diabetics to like live. Like now, a diabetic, even a type 1 diabetic, can potentially live just as long. I think type 1 diabetics, the life expectancy is a bit lower, but it's still like 70 or something like that, I think, that's off the top of my head. But type 2 diabetics, if they control it and treat it well, can live to like a normal lifespan, right? But type 1 is more severe. Maybe it's 60. I'm literally just fucking spitballing, so please forgive me. But type 1 is obviously harder on your body and more difficult.
That's wonderful. But how do I
But
make
type 2
money off
diabetics,
depressed
as long as you
people?
control it well, are you laughing? Hey! I don't blame Reckful, to be honest, if this is my therapist. I disavow. Thank you very much. But yeah, type 1 diabetes is pretty rough.
Using their tongue. And then I think they see that this leads to better outcomes over time. So I would not call that a correlation. I think at some point in the system of medicine, what you always have is an intervention, and then you measure that outcome in some way.
I guess to me, unless you
How the fuck are you measuring? I mean, what, a diabetic in India? How long ago are we talking? They probably fucking died by the time they're 40 or something. How would you measure any of this? How would you... Literally saying the anthill method is the way you measure it. I did some more Dark Viper stuff earlier, but yeah, that's it really.
randomize it and control for biases, it's not that.
That's a huge problem, but in the opposite way. So here's the key thing. So when you randomize, so we view the RCT as the hallmark, right? There's a huge
off depressed people.
A boat sails near the
Thank you for the
Indian coastline.
333.
A group of street shitting pirates come onto the boat. One of the street shitters walk up to the captain. I am the doctor now. Ayurveda.
Huge problem with the RCT. So let's say I show you an RCT that says that cholesterol, let's say like cholesterol lowering medication. Mm-hmm. What is the outcome for an individual patient when you prospectively give them a cholesterol med?
You're talking about number needed to treat.
No, I'm not talking. Oh, yeah, sure. But So if I come to you,
By the way, this guy's a psychiatrist. This guy's a fucking psychiatrist. Like, I feel like he's a psychiatrist and he has studied psychiatry, but he speaks broadly about this stuff, about conditions he's got no real business in dealing with, you know? He's like a more retarded Jordan Peterson.
That like 99% of the time for the individual, it's not going to have an impact. But for the general population, you will see it.
So this is really important to understand. So our system of medicine does not make predictions about individuals. It makes predictions about populations. So Ayurvedic system of medicine is completely different because they don't care about populations, they care about individuals. So their whole system.
It's the way that he talks about like Western medicine as if it's like a completely faceless, you know, insurmountable thing. It's just not true. That's just not fucking true. That's total copium. Like, bro, what is he on about? Who has been to a doctor? No, it's not kind of is at all. You're coping. You're some fucking alternate medicine shill retard. Okay? It's just not correct and not true. That's not what it's like at all. And if you disagree with you, I hope you get cancer. Okay? Because then you'll fucking see what's going on. Go into your fucking treat. Oh, I've got cancer. Give me my bitter melon or whatever. You'll be fucking dead, you retard. And we'll be, okay, I need to be careful, too. To be fucking...
Medicine does not make predictions about individuals. It makes predictions about populations. So Ayurvedic system of medicine is completely different because they don't care about populations, they care about individuals. So their whole system, so if you think about randomized controlled trials, what we're literally doing in that trial is removing the individuality from our system of medicine, which then creates a problem of external validity. So the basic problem of our studies is that we can do a study on 10,000 people, but you know this as a clinician. This is why we need clinicians, because your human brain needs to take all of this data and then translate it to apply it to an individual. So in the Ayurvedic system of medicine, they think that randomized controlled trials are the antithesis of practicing medicine.
Can I explain why I heavily disagree?
Yeah.
Well, I agree with, first of all, the notion of why we need clinicians, of taking generalized concepts and individualizing it to the person in front of us, 1,000%. And I think that's what my residents get wrong the majority of the time. I just did a video on this because...
This is true if you're the kind of person that will get cancer and go and get acupuncture. This is true if you would get HIV and you go to fucking homeopathy for your HIV meds, all right? That is true if you're that retarded, and that's it, okay?
The idea of number needed to treat, just why I brought that up, is because it's a topic where, for example, lowering blood pressure, we see population-based, controlling it to a certain number will prevent 30% of heart attacks and strokes. But for the person sitting in front of you, 98, 99% of the time, it's not going to do anything. So the question of why I still, the reason why I think randomized controlled methods are still the best for the individual is because we're throwing out the baby with the bathwater.
What does that mean?
We're throwing away randomized controlled studies because they're imperfect to the individual. I think we need to look at it deeper and say, right now, this is the best knowledge we have for the general public, which will ultimately be the best for you because this is the best information we have. In the future, as algorithms, as information gets better, I think we can better individualize randomized controlled studies so that we can run simultaneously thousands, millions of experiments to know, instead of 80 patients I need to give this blood pressure medicine to prevent the heart attack, only 10. So now I'm targeting the therapy more towards the individual and less towards the general public.
But so then ideally what you would want is not even a randomized control.
By the way, when he says, bear in mind, when Dr. K says the individual, right, what he's thinking in his head with Ayurvedic practice in mind is figuring out which dosha the person is, okay? That's the whole point of Ayurveda, is you've got this fundamental dosha, and then once you figure out what the dosha is, and just in case you weren't watching earlier, the three dosha are Vata, wind, Pitta, fire, Kapha, earth, water. So that's just probably ticking through his head as they're talking.
Controlled trial, you would want trials on an individual, right? Because that's when you produce perfect correlation between your scientific
Absolutely
methodology.
not.
Explain that to me.
Too much bias when you're treating a single person.
But isn't that what you're looking for? Is you want an amount of bias that is specific to the person. So let me give you an example.
I think bias works both ways.
So let me ask you a question. So let's say so we now have some of these services in psychiatry where you can do genetic testing on a person.
Correct, to see which medication is going to have the best.
So do you think that those kinds of these are not recommended by the American Psychiatric Association?
Yeah, I just had a patient bring this in last week.
Yeah. So I don't use them usually in clinical practice because the data does not show that using these services in randomized controlled trials is effective, which is hilarious.
Okay.
Right? So I'm with you there. But let's say theoretically, if we could get to a point where that did work and we can recognize that, okay, this person has this kind of serotonin transporter gene and this kind of medication is effective, do you think that is that the kind of goal of personalized medicine, is to create a system of understanding this person as an individual, not worrying about the population? It's what are your policies?
If we had some... God, this is so retarded, man. Yeah, if there was some way we could progress forward and figure out, based on someone's genetics, and we had some tests to figure out the exact perfect medication to treat them, great. Then we could look at it from an individualized perspective. But that's not going to come out of thousands of years old fucking Indian treatment as whether someone's a fucking pitcher or not.
Wind,
Bro.
fire, earth/water.
Thanks for the super chat.
Combined, I am Dr. K.
It's like, if we have some scientific fucking advancement, yeah, that'd be good. But it's not going to come out of Ayurveda, is it? Which has existed for thousands of fucking years. And, oh, dude. If we had a magic thing that meant we knew how to treat people, yeah, great, but we haven't got that, have we?
Polymorphisms, so we can figure out the perfect medicine for you.
Yes, but the only way we can get there is with randomized controlled trials.
How?
Oh my God, yes! Dude, this doctor's based, and he's saying things that I totally agree with.
So,
in order for us to know that this works on this person.
Oh, we have to say a randomized controlled trial that this is effective for lots of people. Yeah. So the methodology is personalized. And then we are doing a randomized controlled trial on personalized methodologies to see that personalized. That I'm with you 100%.
Okay.
So when I look at the Ayurvedic system, I think they're closer to that personalized method.
It's all just cope to defend and push Ayurveda. But dude, it is fucking pseudoscience. There's no fucking good quality studies that back it up at all. And it's been done. It's been looked into. It's not like people have... Dude. These people... How do people take these people seriously? I don't get it, man. I don't get it.
Okay, that's wonderful.
It's crazy to me. This guy's a fucking quack on this topic. Thank you for the $10.
Methodology.
Don't you feel like there's so much bias in that approach, though, when they try... Like, for example... I had Dr. Gundry on my podcast who makes a lot of claims that disagree with a lot of the big institutions, the American Academy of Family Physicians, United States Preventive Task Force, the American College of Cardiology.
But how do I make money off depressed people?
$20 from Blaze11592. Hey, so you may have already said this, but I was working last night listening to your last VOD and halfway through it got private. Was it because of DV?
Blaze, thank you so much for the $20. That is exceptionally generous of you. And I will tell you right now what is going on with that, because you've been so generous to me when it loads up. It looks like it is privated. I'm not sure why. Maybe DK did that for a certain reason. Does it need to be privated, or is that an error? I thought it was back up. In any case, if something is ever privated on YouTube, you can watch it on Twitch or even Kick. I know it's not ideal, but yeah. Dr. K is a quack. Oh, okay. Does it need to be on private? Well, I don't know what. I can't remember what's in it. Did I break the rules? I can't remember. Just being on the safe side. Okay, you have to watch it on Twitch. I'm sorry. I'm sorry that we can't. We're just playing it safe because obviously our channel has been under a little bit of an attack. Just watch it on Twitch.
That's wonderful. But how do I make
money?
Hey,
yo, Tizzy!
You can have a little bit of arsenic in your Ayurvedic tincture as a treat, cancer patient.
Thank you very much for the 500 bits. Appreciate it. Anyway, Tizzy, the last time I covered this was shared my frustration, I think, at this. But yeah, I mean, oh, there were some slurs as well, wasn't there? Yeah, true.
Etc. And when someone presents information that disagrees with large bodies of evidence or large bodies of medical groups, you need to show me amazing evidence to show why you know, but the rest of the people don't. Like, you need to show me corruption on their side. You need to show me why you believe what you believe, what evidence you're looking at, etc. But when you're treating one person, to make your treatment successful doesn't require a lot of evidence.
How are you defining evidence?
In the statement that I made, evidence that I need to know that they're telling the truth is randomized controlled data.
Bro.
So how can you have randomized controlled data on an individual?
By scaling it.
But then it's not on an individual, then it's on a population.
It's individual population medicine. Because that's what an algorithm would do.
So you're talking about doing an RCT on individualized medicine versus population-based medicine.
Correct.
Yeah, but I mean, I don't think we're disagreeing here, but what I'm kind of pointing out is, so let's talk about clinical practice, right? So when you know what works for this person, you have a pile of RCTs, but then you as a clinician individualize your treatment.
Of course.
Deviate for protocols to get the best clinical outcome.
Correct. And this is a practice. It's an art. Two doctors may recommend two different treatments and both be acceptable.
So in this situation, how would you describe what you're doing? Would you call this individual practice of medicine? Would you call this
the art of medicine?
Okay. So I think Ayurveda leans more into that. So Ayurveda basically says, okay, if we look at individuals, there is no such thing as an independent disease process that exists outside of an individual. That every disease process gets personalized when you stick it in a person. And so their approach, so I personally think that if we want to see proper...
Okay, I don't know if he's going to get to it, but why is he not talking about what the individualized concept is in Ayurveda? Why is he not talking about dosha and pitta? Maybe he gets to it, but that is what Ayurvedic medicine is about. That's the individualization, which is obviously fucking retarded and absurd. And I wonder, I could be wrong, I wonder if this is a bit of a PR spin for Ayurveda, where he's not going to go into the obvious on the face of it in the front of a doctor, the absurdities of it, when it's clearly fucking ridiculous to talk about it's like talking about chakra or something,
outcomes from Ayurveda, we can never do an RCT. Because their whole system of medicine is that depression in me and depression in you is different. Which, by the way, it's really fascinating that we're moving in that direction. I'll get to that in a second. But what I think we really need to see for Eastern medicine, the right kind of study is actually a cohort study. So what we really need to do is take a cohort of people, give them Eastern medicine, cohort of people, give them allopathic medicine, and see who has better outcomes.
Well, that's not a cohort.
What do you mean?
In a situation where you'd randomize people and you'd say some of your, you mean you want to do a comparison cohort as opposed to give someone true Ayurvedic treatment versus a sham.
No, I'm talking about cohort studies. So a non-inferiority trial between traditional allopathic treatment and Ayurvedic treatment. Because the whole point is that their system of diagnosis presumes that there is not a treatment for depression. And then what we do is we take that...
By the way, I feel like this is something else these quack fucks do as well. They act like, we need to do all these tests and stuff like that. Where like a lot of this stuff has been looked at, has been tested, and they've looked into this stuff. And unless it's some fucking... alternative health fucking journal or Ayurvedic medicine practice or something, like universities and doctors, people that aren't, their only bias is to checking if something works genuinely without any ideological kind of like, oh, I need to show that Ayurveda works or something, right? This stuff has been tested and looked into. Like a bunch of this stuff has, and they always want more and more and more and more, And I feel like this is a bit of a strategy that these quack fucks use in order to kind of extend the time with which they can continue to push this stuff. So it's like, well, we need to do more information and more research and more stuff on it. We need to keep looking. Guys, it's really important that we keep fucking looking at this. Okay. I don't think enough research has been done yet before we can say conclusively this doesn't work. Right? Oh, there is mixed information about it. Actually, there is mixed information. And wait a sec. And then there's this organization, which hopefully it works now, which, by the way, Dr. K is a member of. Promote and establish Ayurveda as an evidence-based health science globally. Interesting. Interesting stuff. What is his role in this? Oh, he's a member. He's a member of this. He's connected to quite a lot of these alternative medicine groups, it seems. Ayurveda Journal of Health, Journal of Complementary and Alternative Medicine. Interesting stuff. Bro. Oh my God.
thing. We remove all the individuality, which is a core part of their system of medicine. So their whole system of medicine is that. So there's even like, so for example, they believe that, you know, the man. I'm extrapolating here based on
like, do you is there a reason he's trying so hard to PR spin Ayurveda here? I wonder. Do you know what I mean? I wonder if there's some reason that he's so concerned with doing that. Like, I do not know if there's links to say conclusively, but my hunch is that there's some sort of vested financial interest for him, and the heat got too big. Like the Gamergate project initially promoted the concept of Ayurveda, but then had to step back when he got criticized and called out for it. But I think that this is pretty clear. He still wants to run fucking PR shit for it, and it's probably because of some financial incentive, I guess. I agree with him. They have a dual loyalty. What's that supposed to mean?
my expertise, but if you look at like depression, there are three subtypes of depression. So there is neurovegetative depression, right? So difficulty getting out of bed, things like that. Then we have anxious depression. We recognize these as two clinical entities. There's a really interesting third subtype.
This Dr. K shit is 100% obvious to anyone who doesn't hate their dad and don't feel like they owe brown people something for imperialism. True. Yeah, sure, I'll take your arsenic-laced medicine because obviously imperialism was bad. Glug, glug, glug.
Subtype of depression called depression with anger attacks, where the primary manifestation is frustration and anger as opposed to feelings of sadness. Now, the really interesting thing is if you look in Ayurvedic medicine, they say that there are three dominant elements. There's like the earth element, there is the wind element, and then there's the fire element. So if you take this
that was a bit of a pause, Andy. I wish that he'd use the actual names, dosha, what is it, pitta, vapor, or whatever. He did mention it. I'm fascinated to see what this guy says about this.
Depressive pathophysiology, and you stick it in someone who is a predominant earth type, you will end up with a neurovegetative depression. If you stick it in a person who's a wind type, you will end up with an anxious depression. And if you stick it in a fire type,
roast him, Pokemon,
you will end up with a depression with anger attacks. So even in their literature, they have these three subtypes of depression built out, and they say that it correlates with something about your alleles and how they manifest, your phenotype.
I think we're talking about two different things. I think Ayurvedic medicine does fantastic observation.
Yeah.
Like what you're describing is they've observed different
100%.
subtypes. And I think that's, you're going to get amazing validation even when you check individuals, when you do good observation. I think when you say we should do a cohort study to see if it is non-inferior, to me, that's the same thing as an RCT. Like it's not the gold, like for us, an RCT is the gold standard, right?
Yeah.
But we have levels, a hierarchy of evidence.
Oh, yeah. Metal toxicity from Ayurvedic medications. Heavy metal poisoning from Ayurvedic medicines. Now, to be fair, I don't think that Dr. K himself pushes this kind of medicine, but there was some stuff that I showed it earlier, the wiki page, and also I wonder if he would ever end up recommending an Ayurvedic person. But, you know, if you get into Ayurveda stuff, who's to say that you're not going to speak to someone that might fucking push something your way that's going to be insane? Keep scrolling. What is this? A recent study found that 1 out of every 5 Ayurvedic medicines purchased online contained lead, mercury, or arsenic. In recent years, several children of Indian descent in Minnesota have had high levels of lead or mercury in their blood that were traced back to Ayurvedic medicine. Jesus Christ. What heavy metals are found in Ayurvedic medications? Small amounts. Some Ayurvedic products contain heavy metals because of their possible healing effects on the body. Small amounts of lead may calm the stomach. Arsenic can be used to treat some types of cancer, but may also cause skin, lung, and bladder cancer. Because mercury is toxic, it has been used to kill bacteria. Some herbs are unintentionally grown in contaminated soil or processed with equipment that introduces metal into the product. Even tiny amounts of lead, mercury, or arsenic can harm the body. Claims that they could be detoxified are not supported by research. No, Chud, there's a reason for this. Let me get my broom. Right, okay. Fucking hell, man. These products are often used without regulatory oversight. so consumers have to decide whether to use them or not without complete safety information. 1 in 5. That's the thing that I saw too. 1 in 5. Oh my god, dude. Yes, okay. If criticizing this stuff makes me a white supremacist, then you guessed it, I'm a white supremacist.
And cohorts are still up there. It's not just mechanistic, right? Like if you do a cohort study.
Okay, I mean, yeah, obviously I was hoping he was going to go to town on this, but he's being polite. I get it.
Cohort study and RCT are two completely different study designs.
I agree, but in terms of weight of evidence,
Fine,
they're high levels.
No, but a weight of evidence is fine. But what I'm saying is that the RCT as a study design is antithetical to the system of medicine.
Sure, and I'm just using RCT because it happens to be the gold standard. Let's take cohort, let's take RCT, all the higher levels of evidence. They're not done for Ayurvedic medicine, at least the majority of it. So granted, we can't do RCT, but we can do cohort. Those things aren't done. So I feel like we are taking what they're doing and you're seeing it as a leaning towards story, towards observation, away from the evidence-based model. And I see it as full one-sided.
Well, I don't follow you.
You said earlier a statement that it leans towards the story-based, the individual-based versus the group randomized controlled. I think it doesn't just lean in that direction. I think it's fully in that direction.
Absolutely.
Okay, that's
right. So
wonderful.
I think
But how do
Ayurvedic
I
medicine
make
is
money?
not about
$5.
populations.
People.
It's very different. So I think that that's fair.
Well, for example, you were talking about the art of medicine. I think that
but instead he'd rather use wheelchair symbol, Western medicine. Save yourself from wheelchair symbol, medicine, Israel, medicine for life.
Thank you for the super chat.
there needs to be a cautious balance between taking good quality evidence, whether that's RCT, cohort, et cetera, and then balancing that with the individual in front of you. But I think in Ayurvedic medicine,
this is boring. Go and watch something else. There's like tons of content on YouTube you can watch if you're doing like this. Good luck.
we're just having full-on art.
100%. So there are.
It's not 100% because they are taking into observations and all that.
So, I mean, I'm sort of addressing the questions you're asking, but I am not a proponent of Ayurvedic medicine, even as it stands today. I know it sounds kind of weird because I'm talking about it. So my.
Okay, this dude is fucking coping, man. There's numerous videos of his past where he is fucking promoting and talking about it as to the fucking healthy gamer shit. Like, this is cope. This is cope from him, and he's trying to distance himself while spinning massive PR for it, and has in the past done numerous videos, you know, talking about how great it is. I mean, we watched a few clips of it earlier, and yeah, I mean, okay.
I am not a proponent of Ayurvedic medicine, even as it stands today. I know.
By the way, this guy is associate editor of the Ayurveda Journal of Health, okay? And he is also a member of the Council of Ayurveda Research. Does that sound like someone that doesn't have any sort of vested interest in pushing Ayurveda or talking about Ayurveda or liking Ayurveda? Really? Come on. Hey, Pans, how's it going? This is where we met. We met over this stuff, didn't we? Yeah. Yeah, what was it again?
It sounds kind of questions you're asking, but I am not a proponent of Ayurvedic medicine, even as it stands today. I know it sounds kind of weird because I'm talking about it. So
he's not a proponent of Ayurvedic medicine, so probably want to cancel your membership to the Council of Ayurveda Research, and also stop being associate editor of the Ayurveda Journal of Health, I would say, if you're not a proponent of Ayurvedic medicine, I would say. But what do I know? I'm just a layman at the end of the day.
before this whole healthy gamer thing, my actual area of interest was evidence-based complementary alternative medicine. So there are all kinds of problems that we haven't even touched on. I mean, here you are saying, what about this? What about this? I can dismantle Ayurvedic medicine because there are fundamental weaknesses. The first fundamental weakness of Ayurvedic medicine is that you have no way to gauge practitioner reliability. The good thing about allopathic medicine is that, at least in the United States, if you finish a medicine program, there are standards that people can expect. If you go, you're a family physician, I'm a psychiatrist, but two people who have a heart attack on an airplane, they're going to get some comparable care, right? Even I can handle that some. So the biggest problem with Ayurvedic medicine is when you have this individuality, how do you judge the quality of a practitioner? How do you know ahead of time whether this person is good or bad, whether there's biases in their patient population, if their patient population has size?
Well, the reason he can get away with this is because he went he went on this massive PR campaign on Twitch, and he interviewed all these big fucking streamers. Like, that was part of his thing in how he got a fucking foothold in and got to a point where people defend him, to the point where they're defending fucking what is it? Voodoo, fucking Indian medicine shit. It's insane. And yeah, the OTK people, because he came forward and his message was, I just want to help gamers with their mental health. A very noble goal, you know, a very fucking noble goal. And then if you go and look at some of his videos, he's fucking ushering in the fucking underhandedly ushering in the Ayurveda shit, you know? That's what it comes across like to me anyway. But yeah, he got massively promoted, spoke to a bunch of big streamers. You know, dude, there's a whole thing. It's a whole ass thing, okay? I think this guy has got a connection to Ayurveda, wants to push it, wants to shill it. That's why he's fucking talking about it like this. That's why he's PR spinning for it. He's got links to organizations, which I'm guessing he doesn't disclose in this interview. Like, it's anyone that isn't a retard knows, okay? It's like Stylo said earlier. Anyone that isn't a complete fucking idiot sees and knows what's going on, okay? It literally is that simple.
High socioeconomic status, and this practitioner is very charismatic, so they're engaging in the placebo effect. How do you even know that their treatments are working at all? This is a fundamental problem with Ayurvedic medicine, which is that the good thing that we get, this is why I think allopathic medicine has grown so well, is because it is reliable. Ayurvedic medicine, I do not know that it is even 10% as reliable as the practice of Western medicine.
So if you think that, why do you discuss Ayurvedic medicine principles often?
Oh,
because I think there is a huge amount of utility to it. And just because this is so...
Also, this is also cope. By the way, that's also cope as well. Okay, he is absolutely, like, downplaying this massively. Okay? Fucking, that, I scratched the surface of this. And in scratching the surface of it, I found that clip of him saying, my Ayurvedic practitioners that I know in India are predicting COVID outcomes as to them needing ICU. Like, he has been a massive proponent of it in a very positive way. And now to sit here in front of an actual doctor and go, well, no, I don't think it's that good, actually. Bro, it's cope. It's pure cope from this guy.
So if we can improve reliability on the Ayurvedic side, then I think we have something very potent, right? So, and the other reason is because I think that, like...
Why? Why do we need to fucking... Why is he so interested in making Ayurveda better? Like, to me, it sounds like if you make it better, you're just making it so that it meets better standards and it just becomes medicine like anything else. Why does it have to be under the label of Ayurveda so fucking much?
What is the thing that you think that's potent?
What do you mean?
You said that if we improve reliability, we'll have something on the Ayurvedic side that's potent. What would be potent?
So I think that they take this individualized approach. So in my clinical practice, the more that I think we get taught... In Western medicine or in medical school, we tend to get taught the population-based medicine way more. And like you said...
I think he just wants better medicine in general. Okay. I'm not as mad at you as I was last time round. Okay? I'm not as mad as I was last time. I don't care anymore because I'm so black-pilled about content and shit. Okay? But if that was true, he would completely shed all the Ayurveda shit and would just present himself as a doctor and promote the idea of, you know, scientific method. If it works, etc., etc. Why dress it up with Ayurveda? Clearly there's something going on there, particularly with these fucking links to organizations that he's got, right?
We approach. So in my clinical practice, the more that I think we get taught in Western medicine or in medical school, we tend to get taught the population-based medicine way more. And like you said, we call it the art. Why do we call it the art? Because we don't have explicit systems. So the whole point is in Ayurveda...
There's subjectivity to it. That's what art means, right?
Well, the reason we call it art is because we haven't made it scientific. Does that make sense? We haven't conceived of a way to make the art of medicine scientific, which is why we call it the art of medicine. But there is absolutely a logical, scientific method going on in your head.
I think it's an art not because it's not scientific. I think it's an art because it's not standardized. And maybe I'm just
exactly.
mixing
So we
words.
have no. But that's exactly my point. Is we have not developed a standardization. We have not scientifically broken apart the art side of medicine.
I don't think that can happen.
Yeah. Well, so there's a system of medicine that's done it.
Which is what Ayurveda. So
that's what I'm saying is they've taken the individuality.
Do you believe that though?
Yeah, absolutely. There's lots of flaws, but I think that they've done it.
So from what I can understand here, I think what's being spoken about is, you know, in Western medicine, I hate this term Western medicine. It's like conceding to these fucking alternate medicine freaks to call it that, okay? But I think what's happening here is it's a concept that you go to your general practitioner or family doctor, I think you call it in the US, right? And you speak to them and they'll tell you, like they'll speak to you and try and give you a diagnosis and whatnot based on your own personal kind of condition perspective and stuff like that, and try and treat you in the best way they can as an individual, taking into account these other scientific aspects that are going on. And he's trying to act like, well, you know, we do that too. We do have an individual approach, but then he doesn't seem to, you know, he seems more accepting of the quackery to back that up than this guy seems to be, right? This other guy seems to be saying, well, we need to have this evidence to prove that something works and da-da-da. Is that where we're coming from here? Is that right? Primary care physicians. We call them general practitioners. Yeah, I mean, look, I agree with you. I hate using the term Western medicine, and it is the sign of a quack, someone that says Western medicine, right? There's medicine that works and there's medicine that doesn't, okay? And if something from anything works, implement it in and it becomes medicine as it gets proven to work, right? Wait a second.
Side of medicine.
I don't think that can happen.
Yeah, well, so there's a system of medicine that's done it.
Which is what Ayurveda.
Western medicine sounds racist. Good. We've been here before. I've been down this road before, okay? Western medicine is based if it's racist. It's better. I like that it's racist.
So
that's what I'm saying is they've taken the individuality.
Do you believe that though?
Yeah, absolutely. There's lots of flaws, but I think that they've done it. Yeah.
You mentioned we need to bring some of Western medicine into Ayurvedic practice to improve
100%.
Ayurvedic practice. I view that as not an optimal use of time is probably the wrong word. I would view, based on how you describe Ayurvedic medicine, that there's a lot of problems. 90% of it has issues, et cetera.
Yes.
Why not take
Yes.
what works of Ayurvedic medicine?
Yes.
The art aspect of it.
Oh my God. This is what I was... Yes, exactly. Just take what works and implement it. If you got 10% there that works, put that into the other side where most of it's working. Why would you take something that's got a 10% success rate and then try and build that up? Why? It's pointless. It's a waste of time.
And bring it to Western medicine, as opposed to bringing Western medicine and trying to fix something that is really very problematic, already so far gone.
It's a great question. So the
Yes.
first thing is that I think the question is sort of moot because I think both are happening simultaneously. So I think as
Western medicine also assumes that if it's accepted by modern medicine, it must have originated in the West, which is reductive and racist, and yeah.
we progress in our scientific understanding of medicine, we are moving closer to Ayurveda. So that's happening automatically because I think that as we're discovering more of
Actually, Ayurveda's come in because we're doing that. Dude, what on earth?
truth, we're just moving in a particular direction of individualized medicine, which is the whole backdrop. So if you look at our Western system of medicine, the idea is that a disease process is independent of an individual and it has a treatment. So the whole point of an RCT is let's remove all of the individuality, all of the specificity from an individual patient, because if we take an individual patient, we treat cholesterol in this individual patient, we have no idea how that's going to apply to the other 9,000 people we treat because this person is an individual. So let's remove individuality from the equation. Let's look at high blood pressure and let's try to isolate this disease process. Then we run into a problem in Western medicine because you can isolate this disease process in a laboratory, but the moment that you have a real person in front of you, things get complicated. Agreed?
100%.
So Ayurvedic medicine just looks at it from the opposite direction. They kind of say, okay, let's start with an individual and let's understand what works for this person. And then they also generalize. They sort of also have, diagnoses, right? Which obviously means that it's not, there's diagnoses that are shared amongst individuals, but they start from a more individual lens. We are starting at a population level and we are trying to narrow down to personalized medicine. They start at personalized medicine and they sort of extrapolate out to a more general way.
Okay. When we got to India, okay, they were gobbling up fucking arsenic, right? Wiping their ass with their fucking hand. Okay, dude, I need to be so careful. Like this, oh no, we got there, it was fucking everywhere, it was crazy. We had to civilize that fucking place, bro. Oh my God, dude. I just can't bear it. I can't bear this argument that we need to, inherit all this shit from India, where the stuff that's worthy, and maybe there's more stuff to look at, but generally speaking, the stuff that's been around for a while, if it's worthy, it gets fucking inherited already. It's been done already.
Isn't that flawed by design?
Okay, that's
No.
wonderful. But how do I make
It's only
money
flawed by
off
design
depressed
if you presume that the population
Confucius
base
say,
and the
"Man who
system.
take Ayurvedic herb for toilet problem, high on empty pot." Also say, man take herb for insomnia, sleep like baby, wake up every 2 hour.
Thank you for the 400 bits.
It's only flawed by design if you presume that the population base and the system, the existence of a disease process that is independent of people exists.
Wait, say that again?
So do you think that hypercholesterolemia can exist outside of a person?
Like exist in what way? Like on a definition of in a textbook, it can.
Okay. So like, can you have hypercholesterolemia outside of a person?
Yes, in a petri dish.
Okay. Right. So when you translate that to a person, it becomes individualized, right? And then our core pathophysiology, completely agree that you can say, okay, whatever, there's something that can exist in a petri dish. When you translate it into a person, you are adding individuality to it. Maybe the word bias is good here. I don't know the way that you're using it. I'm not 100% sure. So all I'm saying is that the whole art of medicine is we have these general principles that are scientifically true, and we apply them to an individual. And then things get muddy, and we have to include the art of medicine, right? All Ayurveda does is they start with the presumption that a disease process and an individual, that every disease process is going to manifest in a unique way. And that is the foundation of how we are going to approach treatment. So if you say, is that biased in the sense that every treatment is individualized? Yes.
I'm going to make a comparison. You familiar with bro science?
No.
So when you go to the gym and you hang out in the gym environment, there's a lot of guys that walk around to claim that they have the right way of exercising the right way. And it might be the right way for them. But if I in medicine try and take what worked for one person and try and scale it, I'm going to run into a disaster.
Yeah.
That's why I think it's better to look at population and then try and narrow it. That's why I think the principle of starting with one and going up in general.
Bro, he just compared Ayurveda to bro science. That's so based. That's so based, dude. This guy's brilliant. Dr. Mike. Fuck, he's got 12 million subs. I'm going to watch this guy's videos for my own personal entertainment. That's base, though. He called it pro science, dude. Let's go. It's like astrology. Well, it's funny you mentioned that, because that Wikipedia page we looked at earlier, from the Healthy Gamer Wikipedia page, likens it to astrology.
No. Is way more problematic.
No, yeah, but so this is a fundamental misunderstanding. The whole point of Ayurveda is you don't generalize one to the broader population. You develop a system that works for each person ideally. That's what their approach is. There's no generalization. Or, I mean, there's some generalization, some necessary generalization, but their whole point is that when someone comes to you and this guy is a bro science and he says, this works for you, the Ayurvedic doctor says, this worked for you. Let me try to figure out, the next person comes along and they try to figure out what will work for you specifically. What will work for you specifically. They don't care about populations. They care about individuals.
And you don't think that's fraught with forever reliability issues?
What do you mean by reliability?
Again, like the practitioner reliability issues.
Oh, no, it's fraught with reliability.
Like that will never get solved.
I don't know that.
How can
The quack desperately holds on to the idea there's going to be something that happens that proves it's all true at some point. Dude, come on, man. Pans knows, by the way. Listen, Pans in Twitch chat knows about this shit. We spoke about it before because he actually deals with like a lot of this kind of stuff in his day-to-day. And yeah, I mean, Pans knows, okay? Listen to Pans.
Can you have reliability when cults can lead people to do the most ridiculous things, feel certain ways because of the power of the mind to be manipulated? How can we ever measure what one individual is doing?
Not as easy in front of your doctor colleagues and not your tarred muffin gamer audience.
Okay,
Dude, the chats.
But how do I make money off depressed people?
Thank you for the bits, Pans. Doctor cares about to spray turmeric in Dr. Mike's eyes and run away. Base. Thank you for the bits.
Whether or not that's valuable. Because I feel like it's so easily corruptible when we're just treating everyone as one.
So I think maybe I'm foolish, maybe I'm optimistic. So here's where I'm coming from. Here's why I don't think it is an unsolvable problem. So if you look at the history of humanity, we've been faced with unsolvable problems that get solved. So I have faith that if we were to leverage even 10%.
Faith, that's a good word for it. This is like, okay, how do I say this in a way that doesn't offend my religious audience? This is like, there's gaps that's being filled. It's Ayurveda of the gaps, right? There's gaps in our understanding. Well, that's obviously in time going to be filled with what I believe or what I think, right? Rather than, the scientific methodology or whatever is going to allow us to understand and move forward. God of the gaps or whatever, yeah. Okay, listen, sorry to my religious audience, okay? I just don't want to I don't want to atheistize it because I don't want to lose my religious friends, okay? And you are my friends, especially if you give me money, don't forget that.
Percent of the brain that get solved. So I have faith that if we were to leverage even 10% of the brain power in scientific weight that we have in allopathic medicine towards Ayurveda, I think it'd be amazing what we would accomplish. That's my gut instinct. I don't know that that's true. Is it potentially an unsolvable problem? Absolutely. So what I think, though, is that what I've seen already is that it doesn't take a whole lot. So like I think that if we were to put, let's say, to like put together like cohort treatments and we were to start to measure outcomes, so I do think we need to add some of this population-based stuff and evidence-based medicine. So let's compare Rasa Shastra, where someone gives arsenic and all this kind of stuff, to, for example, like Ayurvedic herbs or the inclusion of yoga and Tai Chi. Let's actually take cohorts of these people and study and see what's better and what isn't. And then I think what we'll discover is there can be a methodology, because they still teach general methodologies, but the focus of the...
It's just like, doesn't this sound so inefficient and pointless? Like to invest all this time for something that he himself is even saying, maybe because he's coping in front of the doctor, but he himself is saying that it's only 10% effective. Why? Why do we need to do this? Is it because you're linked to all these orgs that want to push Ayurvedic medicine? It's just... Dude, and the fact, I mean, I don't know if he's disclosed it or not, but surely that would be a thing you need to disclose before you start talking about this. It's like, look, I've got links to these boards that are doing this and talking about this, I would have thought. But no, apparently not. He can just talk about it and not make it clear. I'm assuming he's not made it clear. He's shilling his book here. Yeah.
General methodology is not on a disease. It is on a person. So in Western medicine, what we do is we make a diagnosis and then we treat the diagnosis. We don't treat a person. We don't ask, and then clinically we end up doing this, which is that we start to treat a diagnosis. But then as we actually treat a human being, this treatment of a diagnosis doesn't work like that. The person doesn't take their blood pressure medication. So now you have to have this conversation with them, or they have this kind of side effect, you have to change to this medication. So we end up individualizing, and that's what makes a good doctor. All I'm saying is if you think about it, the actual theoretical, if you read a pathology textbook, which has all of our understanding of medicine, you will not find any art of medicine in there. You'll find it in other textbooks, but not in a pathology textbook. Then in the practice of medicine, we are adding what you call the art. And all I'm saying is there is a whole system of medicine where we take the RCTs and the population-based stuff in the pathology textbook, we add the art. But this is not the bulk of our approach to medicine. This is the bulk of our approach. Does that make sense? Ayurvedic medicine says this is the bulk of our approach. That's the big difference.
Yeah, I'm just viewing starting points.
This PR spin, this Japanese PR spin for Ayurveda is honestly sickening to me, bro. And I feel like he's trying to act like this, you know, this individualized approach. Just, you know, to act, what is that fucking thing? To act like it doesn't exist in the West when it absolutely does. Who, like, you know, I've been to a doctor. Yes, doctors do this. They do treat you as an individual and try and figure it out with the idealized basis of all the understanding that we've got of medicine based on scientific trials and stuff, you know? I don't know what that was. It keeps giving weird glitches. My video card was it. Okay.
Western medicine, we have the starting point of randomized control data, population-based data, that we can then tailor and art and improve our art. We definitely need to improve our art. I will never not support that. Ayurvedic medicine has such a fraught foundation. And we're like, let's bring randomized controlled and evidence and all that to this fraught concept already. Why?
Yes.
I don't think that the fundamental concept is fraught. In fact,
but you said there's like 10% of it is only valuable.
Yeah. But I don't think
it's not, yeah, dude, this guy's so based. It's not fraught. There's only 10% that's worth anything though, but it's not fraught. Like, bro, this guy's coping so hard, dude.
Fundamentals are fraught. I think the fundamentals are actually, I think the reason we practice, the more we practice the art of medicine, the closer we are to the Ayurvedic system. Because that's what their system is. It's an individual treatment.
But we end up there versus starting from there. I think that's a drastic distinction.
Yeah, it is a drastic distinction. But I don't think that one is necessarily worse than the other. I mean, I don't
think that they're worse. I just think if you're trying to start, like if I was creating a civilization and I was like, okay, let me find the most effective way to bring the best medical care. If I'm making a Sims game out of this, I would create randomized population data, and then I would bring in Ayurvedic principles, individualizing it later.
So let me, that's fine. So that's your prerogative. And I would encourage you to...
But I'm curious what you think about that.
So let me ask you this. What do you think is a better system of medicine? A system that is population-based or a system that gets...
How do you start individually without having a general understanding? Well, he was saying that with diabetes, they used to piss next to an anthill And then if the ants drank the piss, then you can probably know they're diabetic because you got sugar in your urine.
It's outcomes that are tailored to the individual. Let's say that I could perfectly diagnose you. I did all the genetic stuff. I could analyze all of your phenotypes. I could analyze even things like your digestion, your digestion, your absorption of nutrients, what kind of absorption difficulties you have. And I understood all of this information about you. Which one do you think would be better?
Of course, you created a perfect example, but that doesn't exist.
So the foundation of Ayurveda starts with that.
Yeah, but it's nowhere near it. It's not even close.
Oh, that's where you got to be careful, right? So I think that it's way closer than what we give it credit for.
You're saying they have a perfect understanding of each individual?
They do not have a perfect understanding. What I'm saying is that the direction that they are moving in is to focus on the individual. So we don't even focus on the individual. We focus on a population. So we have, let's say we'll use a video game analogy. So we've leveled up to level 100 on population-based medicine. And then the reason that we have good clinicians and bad clinicians is that the good clinicians are the ones who have leveled up to level 50 on individualized medicine. In Ayurveda, they've leveled up individualized medicine to level 100, but their population-based...
He's reaching for his old fucking healthy gamer strats. He's desperate. Oh, but RPG is like a video game, right? Dude, bro, this is the shit that works with this gamer retards that watch him, not with a fucking doctor. Come on, man.
Medicine is level 10.
I think when you use that example, when you level up to 100 on the individual level, your data is fraught with error and bias and subjectivity because you're not studying it en masse. And there's so many mistakes that you could make when you're just treating an N of 1.
Very true, right? So, but you're thinking from a population-based standpoint. But when you kind of think about it, and when you treat an individual, you can make so many mistakes. Because that's what you do in your practice, right? You don't treat populations; you treat individuals. So how do you figure out what is best for your individual patient who's sitting in front of you? It's fraught with errors. It's fraught with bias.
All of healthcare will always be fraught with error. Our job is to take the best worst approach. And to me, the best worst approach is seeing what works that's generalizable, continually fine-tuning it, as opposed, if I was building a pencil or I was building a house, it's much better to have the foundation of randomized controlled generalized data and then building upwards to get the subjectivity of how you want the house to look, whether it's pretty. But without a good foundation, that house is going to crumble. And I feel like Ayurvedic principles are built on a weak foundation.
So I think that's it's a very
Okay, that's wonderful. But how do I make money off depressed people?
P. Spray your walls, coat the veranda, if it attracts raccoons, and those raccoons start dancing, call your mother, and if your mother says hi before hello, you got cancer.
Oh my god, dude, it's Dr. K fans. Where are the non-retarded people? Honestly, Dr. K fans are not worth human consideration. They're just the most retarded freaks you can imagine. I remember dude, I literally lost my fucking head with this last time because the amount of gaslighting that was happening from the fans. They were trying to act like all this insane shit that he was saying was actually correct and true.
View. Right. So, and I think that there's good data to support that view because there's a reason why allopathic medicine is spread all over the world and Ayurvedic medicine is not.
Well, that's a good question here to be had. Why do you think in Eastern culture...
Yeah, also, I feel like he did... Yeah,
let's look, whether it's pretty... But without a good foundation, that house is going to crumble. And I feel like Ayurvedic principles are built on a weak foundation.
So I think that's it's a very reasonable view. Right. So, and I think that there's good data to support that view because there's a reason why allopathic medicine has spread all over the world and Ayurvedic medicine is not.
Well,
so there we go. End of conversation, surely.
A good question here to be had. Why do you think in Eastern culture, we never got, well, not we, but why hasn't it moved to a labeling system, a randomized controls? Why has there been so much disconnect between randomized controlled stuff happening in Western medicine, but that is firmly pushed against in Eastern medicine?
Why do Eastern people not like randomized controlled trials?
Yeah, why didn't throughout time, the way Eastern medicine is talked about now is more similar to how Eastern medicine was talked about 500 years ago.
Okay, yeah.
Than Western medicine talked about now than how Western medicine was talked about. Why is that? Why is it seemingly stuck in the past? So for lack of a better word.
What do you think what's the differential diagnosis for why something doesn't change over 500 years?
My skewed skeptical belief is that it's based on
What's
culture,
what's the differential?
religion.
Oh, dude, we're getting close to race realism. Say it, Dr. Mike. Say what you really think. Let's go.
Skewed.
Why something doesn't change over 500 years.
My
Oh boy.
skewed skeptical belief
It's
is that it's based
culture.
on
What's
culture.
What's the differential?
religion.
What? Okay, so culture is part.
Mike, do the needful. Do the needful, Mike. Let's go.
of it. Religions. What else is on the differential?
Lack of refinement.
Okay,
Ooh,
that is also
It's
on
on
the
the differential. I'm not saying it's
yeah,
the cause.
yeah.
That it works.
Absolutely. Right. So that's what's really
Well,
tricky.
well, hold on. We have that it fully doesn't work, lack of refinement, and that it can work. Those are
Absolutely.
possibilities.
Yes. So
we can't give them equal weight here and say, well,
no, but so it's good, right? So now you ask a question, right? That's on the differential.
yeah, I mean,
Maybe
when
the
a
reason-
patient comes in with 2 days of cough, cancer is on the differential, but we don't talk about it because that's not valuable.
Sure, but I think in the case of, let's say, like, let's look at these Eastern traditions. So these are the traditions that gave us meditation, right? So this is where I think part of the reason, and
Isn't it funny how all he's ever got to bring up is meditation, meditation, meditation? Okay. And also, like, meditation is practiced in multiple of these different things as well, isn't it? Right? How did meditation become a sort of considered treatment for depression? Was it because of the Indians, or was it something I don't even fucking know? Buddhists and that do it, don't they? The Chinese, right? And it's mindfulness. That's what it's called over here, isn't it? When it's become white.
like I don't.
When you say a statement like that, you know what I hear?
What?
When a patient comes in with 2 days of cough, if I say that it's cancer, I'm going to be wrong so often, but I will be right sometimes. Ayurvedic medicine, you're showing me came up with meditation. That's that one time they called cough cancer.
Fair enough.
And it turned out to be cancer.
So I
Yes!
don't even disagree
Oh, true,
with you.
yes,
This is
exactly.
exactly where, like, I think that's why. I mean, I gave this example
Yes.
where Dr. Jenninger was like the biggest problem.
Grasping on for the dear life with the one thing, the one example that he's got out of how many why don't we talk about the arsenic-laced medications, Dr. K? Why don't we get to that? Do you know what I mean? What about all the other shit that goes on? No, meditation, meditation, meditation. Why don't we talk about the fact that 1 in 5 Ayurvedic medicines has got fucking heavy metals in it? No, we're not going to talk about that. We're just going to talk about fucking meditation. Yeah, Dr. Mike is winning. Dr. Mike is based. I fully support Dr. Mike. He is trying to be polite. Of course, I get that. You're going to be polite in a conversation. But he's really based.
Problem with Ayurvedic medicine. I'll be the first one to say this, right? So I feel like I'm adopting a pro-Ayurvedic stance because of the way you're asking questions, but I don't use Ayurvedic medicine with the majority of my patients. I use evidence-based techniques with the majority of my patients because they are reliable.
right.
And at the same time, I'm with you that I don't know. So if you look at this text called Charak Samhita, there's like tons of treatments in there. I have no
Yeah, also, Creeman, this is actually a good point as well. How did those 200 IQ Indians figure out that calming yourself down can help with mental health? I mean, exactly. It's like they're pointing to this like the silver bullet, when all it's saying is, if you just try and relax yourself, relax your muscles, relax your mind, put yourself in a place where you don't feel, you're not applying all the stress and pressure to yourself, it will probably help alleviate your mental health issues. And they're acting like that's fucking some sort of crazy discovery, like realizing that radiation can help stop fucking cancer tumors or something, Oh, man. Taking a deep breath.
no idea how many of those are effective as meditation. We even have evidence that some of them are harmful, like Rasa Shastra, right? So I steer clear of that but then the problem in the Ayurvedic system is if you go talk to an Ayurvedic doctor, many of them will not say, oh yeah, this doesn't work. That's a huge problem, right? They'll say like, oh, we don't understand.
And also, yeah, exactly. Yeah. It's like, what are the potential downsides? Maybe you don't get a medication you maybe need to treat something. But I'm pretty sure that meditation is like, if you're schizophrenic, I don't think they're going to be, you've got schizophrenia or some serious mental health disorder. I don't think they're going to go, spend 30 minutes a day meditating and you'll be fucking golden, I think that, and also if you've got suicidal, I would guess that if you've got serious suicidal ideation, I doubt that they're going to say, oh yeah, just meditate a bit. Like there's probably some situations where you do need some sort of medical intervention because it's so serious or severe or something, right? Like obviously it's complicated. I'm not a doctor. But he's using it as a silver bullet when, yes, it helps. Yes, it's part of a treatment plan or something. But it's not the be all and end all of mental health care, this idea of meditation, you know?
It well, or they'll like kind of poo-poo, and maybe they're right, maybe we're right, I don't know. So I'll be the first. So my area of expertise is evidence-based complementary and alternative medicine. So the whole point is that there's something very valuable here. This is my belief.
Evidence-based complementary and alternative medicine. Well, I mean, that's you know, what we got? Meditation. Okay, what's next? What else have we got to look into here? Pretty short list, I'd imagine, but anyway,
something very valuable here, and we need to separate the chaff from the wheat. We need to figure out what is actually really useful here. One of the things that I think we can learn a lot from is that I do believe that their generalized approach, because this is what we end up doing in clinical medicine anyway, is we focus on an individual. But there is always a translation problem from the RCT down to the individual. But there are some major advantages that we get for that. The biggest advantage that we get for that is that on the human race, we have outperformed Ayurvedic medicine. On the level of population, we have.
I love this take as well, that I need to stay in my drama lane from some retard that will probably die if they get a minor condition because they're too stupid to go to a proper doctor, okay? Listen, I'm perfectly comfortable where I am. I'm perfectly comfortable talking about this, okay? You don't need to be an expert to spend a bit of time looking at Ayurveda and go, yeah, this is fucking bullshit, and there's no good evidence to back any of it up, right? You're fucking coping big time if you're acting like, oh no, what? Dude, you don't even need to fucking have any studies or information about this beyond just looking at a few details to know that there isn't anything to back this up. And I've scratched the surface of this Dr. K guy too, okay? This Dr. K guy is like, a couple of statements he's made are insane. And I've spent like a week looking at this 2 years ago. Who the fuck knows what else you would find if you went and looked at all of his fucking videos about this and went and investigated all the things that he's spoken about and all the things that he said across the entirety of time. If you went and looked at his connections with these organizations and found out what links he's got. Who the fuck knows what else you might find about this guy, you know? And, you know, he is using his fucking doctor as a way of, you know, promoting himself. So I think it's perfectly valid to go and have a, you know, as a journalistic practice to understand some of these connections and links that you might have, because it just doesn't make sense. He's sat here saying, I'm not a proponent of Ayurveda when he's got all these connections to Ayurvedic organizations. He's sat here saying, you know, it's only 10%. It's only 10% of fucking stuff that works, but we should invest all this time making it better and making it so Ayurveda works, you know? Like, it just doesn't make sense why you need it to be wrapped up in Ayurveda. If there's 10% of stuff that works, implement it into regular medicine and boom, we're done. We don't need Ayurveda. Thank you very much.
Outperform, because in these Eastern systems, they do not have ways of testing validity. They do not have ways of separating the good from the bad. They do not have ways of measuring a good person and a bad person. So this used to be there, theoretically, if we want to be optimistic, this used to be there historically because of the way that it was taught. So there's this concept of parampara or lineage, where like if you had a good teacher, like, and now things have changed, we can get to this with meditation. So you had this lineage where like you basically have like a system of mentorship where if you trained under this person, you're like going to be good because this person would not let you out unless they were good. There's still problems with bias there, but I think the biggest challenge that we've had in Ayurvedic medicine is we've lost some of their fundamental safeguards like lineage, and then we've replaced it with like standardized education because that's what we do in the West. And so now we have a system that from its bones is open to things like validity, open to things like not being critical of itself. And then we are removing the one safeguard, which is this concept of parampara or lineage. Now we're giving people degrees and certificates from universities. I have no idea how to tell whether someone is good or bad. And what I have seen as a medical doctor, like part of the reason that, you know, I studied Ayurveda, fell in love with it, and then I went to medical school. Because what I saw is that I have no idea what's the quality of education I'm going to get. I have no idea what's the what the reliability of some of these methodologies are. I've seen things that are medical impossibilities from Ayurveda with my own eyes. I've talked to patients that are medical.
It seems so crazy to me that you can go and get a credible qualification from a Western medical school, from a medicine school that just works. Okay, you can go there and get a qualification, and then it lends some validity to this fucking hogwash. Do you know what I mean? Like, he went to Harvard, right? Like, Harvard is lending validity to this. Like, why? Like, what are they? Dude, I don't know. Oh my God, dude. Oh. What did he just say?
The quality of education I'm going to get. I have no idea what's the what the reliability of some of these methodologies are. I've seen things that are medical impossibilities from Ayurveda with my own eyes. I've talked to patients that are.
I've seen things that are medical yeah, I've seen miracles. He's not using the word. but he's claiming that Ayurveda has performed miracles. Shim shalabim, shim shalabim, Kalima. I'm gonna touch your soul and remove the cancerous elements of the soul and get rid of your bowel cancer. Shim shalabim.
Medical impossibility I'm going to get. I have no idea what the reliability of some of these methodologies are. I've seen things that are medical impossibilities from Ayurveda with my own eyes. I've talked to patients that are medical impossibilities, like paralysis, being able to polio paralysis, right, which is a permanent condition. That's not something that generally speaking gets better. These people are able to walk. Mm-hmm. And so when I look at that, it gives me pause, and it says to me, there is potential.
I hope this doctor's got something to say about that, because that sounds insane, bro. Healing hands. Yeah, I was thinking of Doctor Strange as well. Yeah, fucking that guy that went to the Doctor Strange temple and learnt about all the mystic arts and then cured himself. And that black fella comes along and goes, "Oh, I don't think so. I'm taking your magic." And he goes, falls to the ground. Oh, man.
Here. So what did I do? Did I say, oh my God, there's potential here, let me go to Ayurvedic doctor and I'm going to indoctrinate myself? No, I went to medical school, focused on evidence-based complementary alternative medicine, realized that in the grand scheme of being a doctor in the world today, each of us can make a contribution. What do I want my contribution to be? I saw something that I thought was very I saw something that I saw potential in. And I said to myself, even if 90% of it is shit, I can't judge whether 90% is good, 10% is good, 50%, I have no idea. But there's something here that we in the West can benefit from.
So he's trying to push this, I mean, implicitly there is this idea. So 10% works, and within that, there's people that are paralyzed from polio that you can use to make work.
Okay, that's wonderful. But how do I make money off depressed people?
Well, why are we not, dude? So what's that then? Let's fucking get it going if it works.
Okay, that's wonderful.
Hey, thanks for the $5 Australian.
Non-servium
and don't smile. I am racist, yes. Thank you very much.
And that's been what my focus is on.
What do you like about Ayurvedic medicine? What is that part?
So I like that they focus on the individual.
Got it. What else?
I like that they...
Yep, you've said that. We got that. This guy's got it. What else?
Okay. Focus on the individual.
Got it. What else?
So I like that they look at, so just as a psychiatrist, so like one thing that I really appreciated was this concept of like a cognitive fingerprint. So we have this in some ways in terms of like 5-factor model and stuff like that. We have these personality assessments, but these personality assessments are usually done at the population level. And so the translation down to the individual is not as clinically useful as some of these Eastern conceptions of cognitive fingerprint. So when I work with a patient, doing a 5-factor assessment has very little bearing on my clinical practice. But doing more of an Ayurvedic personality assessment has a lot more utility in my limited biased experience compared to some of these generalizable personality assessments. There are some cases where those can be good, but I think that some of this stuff is quite revolutionary because it helps me understand.
Aren't all these personality tests considered to be very flimsy and like bullshit? No? If I remember correctly, these personality tests are all like kind of nonsense. I think. I don't know if there's any personality tests that are broadly considered to be useful and of worth and of merit and of actually integrating into like serious medical practice.
So even like, for example, depression, understanding like, okay, what is this person's Ayurvedic dosha? It helps inform me about how to approach this kind of thing. Also in my clinical practice, what I've seen is if people adopt Ayurvedic diet, they're more likely to have sustained remission at lower medication doses or be able to come off of medication. That is nothing magical, by the way. I think they just sort of figured out gut microbiome observationally, and that now we're discovering the mechanism. But it's really interesting that their first-line treatment for mental illnesses seems to be diet, and my guess is the mechanism is gut microbiome modification to support neurotransmitter precursor production. That's my take. And what I've seen very clinically is when I apply some of these principles to my clinical practice, that patients tend to do better.
So I'm going to keep track of it. Individualism, stratifying personality types, cognitive fingerprinting, as you called it, and then diet, lifestyle, I guess, is one of them. It seems to me, based on this conversation, Ayurvedic medicine is fraught with a lot of bias issues, et cetera, that you pointed out, reliability, all that.
if you eat better food with more vitamins in, you'll feel better. Oh my goodness, the Indians have done it again. They pulled a blinder. Oh my God, that's crazy. What the fuck? I tell you what, it is the Indians have to do very little to get a lot of fucking, appreciation. Over in the West, we've got to fucking cure cancer. We've got to fucking cure cancer, fucking come up with some treatment for AIDS, all this other shit to actually get any credibility, And even that is, oh, well, yeah, we're expecting AIDS to fucking be dealt with, so well done. There's like treatment that's been developed that means that you can be protected from getting HIV, right? So these fuck pigs can go and slam each other left, right, and centre without worrying about AIDS. And that is like, oh, well, that's all right. Yeah, I'll start taking that. Over there, ancient shaman of India, I've come to you. I've travelled thousands and thousands of miles to your holy mountain for you to impart some wisdom on me. Okay? Please, I beg of you, what is your kind elderly words? Eat a bit better. Oh my goodness! Whoa! I don't believe it. Whoa. You eat better? I'll do that straight away. Oh, I feel a bit better doing that. This is fucking incredible. I can't believe I didn't think of this before. What on earth, bro?
Since so much of it is inaccurate, and there's a few things that you think is very valuable that are missing from modern medicine.
Do not eat with shit hand. Oh,
why not take the concepts of those things, like improving the cognitive fingerprinting of modern tools, focusing more on the individual approach, and stop calling it and talking about Ayurvedic medicine? Because it's sexy to talk the truth is used. Seems to me, based on this conversation, Ayurvedic medicine is fraught with a lot of bias issues, etc., that you pointed out, reliability, all that. Since so much of it is inaccurate, and there's a few things that you think is very valuable that are missing from modern medicine, why not take the concepts of those things, like improving the cognitive fingerprinting of modern tools, focusing more on the individual approach, and stop calling it and talking about Ayurvedic medicine? Because it's sexy to talk about Ayurvedic medicine because people are passionate about it. But 90% plus is crap. And yet I feel like we're keeping it afloat.
Well, I don't know that it's crap, and you don't know that it's crap.
Oh, dude, this is the ultimate quack shit that they do. We don't know that. You don't know it's not a bunch of fucking bullshit. You don't know. Prove it's not. Prove to me that it doesn't work. Come on, prove to me this shit doesn't work. Bro, this is exactly what quacks do to keep it afloat and continue it on. Yeah, come on, we need more studies, guys, more studies. I tell you what, if we do enough studies, we'll probably find a lot of it's true. To keep it going, to keep the fucking grift continuing, man. It's classic fucking quack bullshit they do.
Well, we know that it's crap because of how it got to where it is, because of the lack of reliability, the randomization.
No, but we don't know it's crap. We just don't know that it's not crap. There's a big difference.
And
this is unbelievable. Bro, this guy's a fucking doctor. What the fuck? Prove to me it's not a bunch of bullshit, thank you. Come on.
when someone makes a claim that this water will prevent you from dying, or this is the anti-aging water, do you know that this is not going to prevent you from living forever? Like, do you know that I'm lying about this?
No, I don't.
Okay, that's
right?
wonderful.
You need to do a trial.
How do I make money?
But I'm very comfortable
Bro,
as a...
he's having to like lay it out.
And with the meditative words, Makaletska hi, Makahani who, no more sad, now different.
Thank you for the $5.
doctor
I'm
now
with you.
saying,
Bro, that was
water
brilliant.
will prevent you from dying, or this is the anti-aging water. Do you know that this is not going to prevent you from living forever? Like, do you know that I'm lying about this?
No, I don't.
Right? You need to do a trial.
Dude, he's having to explain the concept of what is it called? A non-falsifiable claim? Is that what it is? Is that what it's called? I'm not a philosophizer. He's having to explain the concept in very simple terms to a doctor. This water make me live long. Yes, no? No, how do you know doesn't?
Trial. But I'm very comfortable as a doctor
I'm
now
with you.
saying, no, that's not happening.
Yeah,
Because mechanistically it's not there, the evidence isn't there, and I've gotten to the point where even though I don't have the evidence.
So, Mike,
to say,
what frustrates you so much about Ayurvedic medicine?
I'll tell you why. It leads to a fundamental misunderstanding of healthcare for a large percentage of patients.
I'm glad he's getting a bit more fucking to the point with this, because, I mean, he's been very generous and listened, but it's very clear that he thinks it's a bunch of fucking nonsense. And he's trying to be polite, I guess, but he's more than likely totally bemused by the fact this doctor is saying this shit to him.
Open mental misunderstanding of healthcare for a large percentage of patients. It opens room for health gurus and hucksters to take advantage of people. And
yeah, one's sitting in front of you right now. One is sitting in front of you, mate.
It actually diverts our attention from ways that we can improve medicine.
Okay. So now I'm understanding this conversation a lot better. Okay. So I noticed that this was becoming very antagonistic, which was really weird because I actually agree with the majority of what you're saying.
I see that.
Yeah, right. So I'm the first to kind of say, like, I'm the one who said,
bro, I agree. Dude, this is such cope. I agree with a lot of what you're saying, but he doesn't agree with a lot of what he's saying. Otherwise, he'd go, do you know what? You're right. This Ayurveda stuff, let's just integrate it into normal medicine. It could form a larger part of something. And he isn't being that antagonistic either. In fact, he has been, that's an absurd claim that he's being antagonistic. He has been more than generous to his fucking quackery pseudoscience nonsense, okay? So that he's been antagonistic is insane. All he's doing is questioning him about it and not just accepting it. And this fucking retard is used to all these gamer freaks sucking him off because he's spoken to their favorite streamer and not actually fucking challenging him on this shit.
That, hey, like 90% of it I think could be crap. Mm-hmm. And so I was kind of struck a little bit, and then that's when I realized, like, I'm not talking to someone who has an open mind. Mm-hmm. I'm talking to someone who has a mind made up.
I'm talking about it from a truth-seeking perspective. So my mind's not made up.
Bro, you should have an open mind about this. God, this is all the classics that these quack freaks put out there. Like, dude, I do not understand how people don't look at this guy and go, yeah, he's a quack. He's pushing pseudoscience with this stuff. Not to say, I mean, if he doesn't integrate it into his psychiatry practice, and he just does his Harvard stuff, I don't know. I can't speak to that. But this is crazy. The level that he's fucking spinning PR for this shit.
Okay, that's wonderful. But how do I make money off depressed people?
Sitting Chud bring great dishonor to medicine man Dr. K.
Thank you for the $5.
If you presented some data or information here that showed Ayurvedic medicine is way more accurate than you think it is, I would have changed my mind today.
Yeah, so it's interesting, but I think
I definitely have a bias.
Yeah,
from what I've learned so far.
How is this conversation for you emotionally?
Exciting.
In what way? So do you feel anything?
Oh my God! I don't know if this is editors totally pivoting away. Yeah, where's your fucking evidence, bro? And now he's going to the meta level, fucking psychiatrist. How do you feel shit? God, he is.
Besides excitement?
Full excitement that we're finding a way to truth seek together. Because unlike many people who talk about Ayurvedic medicine in this space, I think you do it incredibly honestly.
So, because I agree with you, but I think there are a couple of things to keep in mind. So when you make a statement like, 90% of it is crap, that indicates bias to me because we don't know that. You make a very good argument that we have to be skeptical based on our understanding of things. That if I show up today and I say like, oh, like, here's a pyramid. If you meditate under the pyramid, like it could work. And then you can always make the counter argument that until you study it, we don't know, they could be right.
Right.
And what I'm also detecting from you is like, I think I'm detecting this emotion of frustration because of hucksters and these kinds of people. Mm-hmm. So I think your understanding of Ayurveda comes from these people. Mm-hmm.
I think he's being too good faith to Dr. K. That's the problem here. And, I get it. He's not going to fucking roast him alive. Okay, I get that. But I don't think he realizes. I think Dr. K has done such a good job of presenting himself in the way that he has, that he's not seeing through it to that degree. I don't know if he's looked at his website and he knows that he's associated with these fucking Ayurvedic organizations, but that surely is a big fucking red flag to the fact that, like, well, why are you connected to these orgs if you're making these claims that you don't have any involvement or interest in it in that way? What about the fact that he's written a paper saying that you can map, well, where is it? What was the title of the paper? Depressive subtypes in Ayurveda. So, yeah, this is basically, I guess he alluded to this. But, like, is this the kind of thing that you're writing if you don't have an interest or sort of, you want to push Ayurveda in some way, Yeah.
And so that's why I was kind of surprised because usually in conversations, I am representing your view a lot more.
Yeah.
Right. So I'll go to these academic conferences with a lot of Ayurvedic practitioners and I'll say like, hey, like we don't know. There are 8 disciplines of Ayurveda. We have some limited evidence of this particular thing, Brahmi, turmeric, ashwagandha, like a set of herbs. We don't have a whole lot of stuff on this. And so I think it's just been really interesting. Now I understand a lot more why this conversation is going the way that it is, which is that you're asking me all these questions, which I get the sense that you're sort of open to the answer, but I think you're asking questions that are not open-ended questions. You're asking questions where you already have a hypothesis and you are asking me to reflect upon that hypothesis or even counter that hypothesis or support it.
That's fair.
Which is, I was just...
And I think our hypothesis is similar.
Oh, no.
Yeah, so I
he's
think...
giving too much ground to this guy.
I think...
Bro, he's totally flipped this now. And he's doing... Dude, he's taking it to the meta level. Oh, fuck. He's such a little rat. He's fucking metaing him out of the conversation because he's on the back foot over this questioning about fucking evidence and shit. And the topic of evidence comes up and he immediately goes fucking meta and all of a sudden we're fucking out of there and he's putting it on him. Oh, God. Am I crazy? Am I reading too much into it? That feels like what's fucking happened.
That you would benefit from studying Ayurvedic medicine.
Agreed, which is what I'm hoping in this conversation I can learn more about.
So I think just this individualized approach, it's so axiomatically different. I think there's value to it.
Back to the individualized approach.
Without a doubt.
And in terms of why not translate it over...
Back to the ground that there's some agreement that an individualized approach can have a benefit. Like, dude...
I think there are a couple of... I think that's good, and I think that's part of the direction we should move in. Mm-hmm. And I think there's a slight problem with that, which this rubs me emotionally the wrong way, which is that there's a certain amount of cultural appropriation to it. So if we look at meditation, let's go back to meditation for a second. So we look at meditation and we kind of say, okay, mindfulness is scientific, this is good, this is good, this is all woo-woo.
Let's go back to the meditation again. Bro, you've already discussed meditation like 10 times. We get it. Meditation is good, and it came out of it, okay? What else have you got except for fucking meditation, bro?
But if we kind of think about it, what's happening is we're taking all of it was woo-woo, and then we're taking this and we're saying the rest of it is woo-woo. We're taking this and we're saying the rest of it is woo-woo. We're taking this and we're saying the rest of it is woo-woo. Now, this is very reasonable from the sense of how does science progress? We have the unknown, we take a chunk, and now this is known, and here's the unknown, we take a chunk. It's very reasonable. On the flip side, I think what ends up happening is if this was our original chunk, and we say that this much is, and I don't think we're nowhere near that, we're like right here in meditation. If we say that this much is valid, there is a certain bias that can set in of we're not sort of recognizing that 60% of this stuff was correct. We're sort of saying 100% of it is always wrong because we move the stuff that is scientifically valid over to science and we remove it from the realm of, let's say, spiritual tradition.
But have we done that?
That's what's happening. Absolutely.
In what way? Can you give me a specific example of that?
Yeah. So like cardiac coherence breathing. So for example.
What's that?
So we have this in the East, we have this system of prana. Okay. So this is chi or vital life force. There's no scientific evidence of this. The best example that I've ever heard is, once again, researchers at Harvard discovered that there are channels of electrical conductance in the interstitial space that are variable. So they were like, oh, have you heard of meridians or nadis like this in Tai Chi?
Bro, is he bringing up chi as well, dude? Where's he going to go with this? Where's he going to go with this, bro?
Them, yeah, but I don't really understand.
So there's this idea that we have this vital life energy that flows through us. It flows through these channels. We biologically looked for it and we can't find anything.
Well, we can't measure it yet, right? We might. In the future,
we
might not just have the tools to currently measure it.
Yeah, so
I'm open to that.
Yeah, so and that's where some people are looking for it. And one person, for example, discovered that there are interstitial channels, basically, that don't have a tissue difference. There's
okay. I feel like this. Okay, I feel like what's happened here is I feel like Mike's been put on the back foot with the meta conversation aspect. Okay, and now he feels like he needs to demonstrate. Oh, I do have an open mind. So he's being open-minded to stuff that he just shouldn't be open-minded to. What you genuinely think that we're gonna fucking prove chi is a thing because there's some not yet understood aspect of our body. I need to watch that video. What's that video where that fellow? Okay, I don't want to spoil it. Hang on. Yeah, this is it here, I think. Is this it? No, it's not this. Hang on.
Breathe in, pull the energy in.
Yeah, this is it.
Pull it down, and push the energy out the hand. Big breath. More power, yeah. More passion, more power. Big. Look into the hands. Good. Yes, Magnus, good. You want to defend? Oh, got you. As soon as you see me move, everything you got in there, you push it out. Well, can we do it? We can do it. All right. Let's go. Sure.
Yeah, this is the one, I think, yeah.
You ready? Yes, come here. You stand here, and Magnus and Rebecca, you prepare her.
So good, man. So good. And then he... The chi was a bit off, guys. Anyway, eventually science will explain all that, so don't worry about it, okay?
There's a change at the level of the electrical conductance, but there isn't like a physical, like, you know...
Anatomical thing.
Yeah. So it could be there, sure. But I think what's really interesting is we have no scientific evidence for that. So then we have these systems of something called pranayama, which is you do these techniques which are designed to basically stimulate this vital life energy, which we have no scientific evidence for, okay?
Thinking the West can't benefit from the individual med format. Okay, Gollum, you are demonstrating how retarded you are, okay? It's not saying that there can't be some benefit in some sort of approach from a practitioner in dealing with a certain issue. The point is you don't need to wrap it up in Ayurveda. That is the point that's being made. It's not saying, oh, it's useless to take an individualized approach. And by the way, it's cope to act like the Western medicine doesn't do this, okay? But the idea that it needs to be wrapped up in Ayurveda is only beneficial if you're trying to shill Ayurveda. Because why? Why does it need to be wrapped up in that? Why can't you just say, okay, here's an approach that they use that's beneficial to the patient. Let's try that and see what happens, you know? Test it, etc.
Okay. So when we move something, and so then we'll take this Sanskrit practice of pranayama, and then we'll turn it into a scientific term like non-sleep deep rest or cardiac coherence breathing or things like that. These are all yogic practices.
What do they mean? Just so I can follow along better. Like what is a cardiac breathing?
A cardiac coherence breathing is basically alternate nostril breathing. It's this old yogic practice called pranayama. I mean, or nadi shuddhi. And what we kind of do is we try to figure out, okay, what is the distillation of the scientific principles, and we're going to kind of give it a new name. And then I think something is lost there because the moment that we denude it of spirituality, there's a good reason to do that. Because I think you...
Right, okay, right. There we go. Now we're getting somewhere with something. There's spirituality in there, guys.
You sort of need to do that because from a scientific RCT perspective, you need some way to standardize the protocol, and you need to make sure that everyone is like working with the same thing. So there's good reasons to do that. But there's also losses in that, which is that we're removing it from the spiritual tradition, which I think is actually where a lot of the therapeutic value is. So one example of this
Come on,
is
please,
something that's
say
growing
something.
a lot, which is non-sleep deep rest. Have you heard of this? Okay.
Like micro naps?
No. Okay. So it's a practice that's called yoga nidra. So yoga nidra is yogic sleep. So it's this like ancient yogic technique, and we basically medicalized it by protocolizing it, sort of reducing it in some ways. And what they actually do is intentionally remove a lot of the spiritual woo stuff. So then we do studies on it, and non-sleep deep rest has good outcomes. So we know, for example, that yoga and tai chi outperform standard exercise when it comes to things like osteoarthritis or mental illness. There are RCTs. You're familiar with that?
Familiar with that research?
Yeah.
That they outperform it? I'm not sure.
Okay.
Yeah.
So there's some studies that show that. And then so actually, let's do a quick aside. So that's what makes me really wonder about the value of some of these traditions. Because if we look at studies that show that yoga is superior to physical exercise, so there's one paper from, I think, 2016 in the New England Journal of Medicine on Tai Chi and osteoarthritis that basically showed that it was very effective. So then, interestingly, from a scientific perspective, if we say, okay, like if all that exists is physical, then exercise should be the same as Tai Chi. The other way to think of it, look at studies that show that yoga is superior to physical exercise. So there's one paper from, I think, 2016 in the New England Journal of Medicine on Tai Chi and osteoarthritis that basically showed that it was very effective.
Wait, so there's one... Wait, hang on a sec. I don't know, bro. It just feels like he's just hammering shit out there. Japanese. Indianese. And it could be that one paper found something, but like... What? So, wait a second. So he's trying to argue that specifically Tai Chi is better for this than just exercise. And did it actually show that? Like, dude, I remember when I looked at this before, he referenced a study and... God, I need to bring up the thing. I can't remember whether or not... He's got this habit. He's got this little habit he does where he chucks out this idea of this study, and like without knowing the fucking, I mean, it's classic. It's debate fucking pedophile shit. You chuck out a study. Oh, well, this study says this. And obviously, if you've not looked at it and you don't know, and you don't know the methodology or anything about it, it's like, well, you can't really comment on that and you can't really speak on that, you know? And you're relying fully on this guy representing things accurately to, you know, make that argument, and you just don't know.
So then, interestingly, from a scientific perspective, if we say, okay, like if all that exists is physical, then exercise should be the same as...
And also, if it's like Tai Chi, are we really saying that it's the Tai Chi element that actually is beneficial? I mean, could that be maybe some sort of placebo thing? Could it be that it's the actual movement that does it? And because it's got a fancy name, people think, oh, well, it's better, you know, in that respect. I don't know.
Tai Chi. The other way to think about it is that even if it's still physical, it's not necessarily that energy exists, but when you use this heuristic or this concept of energy and you develop a practice based on that concept, the physical biological postures that you do are somehow superior to this other set of postures that is...
And also notice how it's like something like, what is it? Is it osteoarthritis? Like, you know, if someone wants to do a bit of exercise, okay, and wants to fucking have some extra benefit and think of it a certain way, like essentially, these are my magic exercises, is essentially what is being said here, right? These aren't just normal exercises. These are magic exercises and they're better. And you conceptualize that as Tai Chi. Yeah, go fucking crazy with that, okay? If you want to do that, that's your right, and you want to have your magical fucking shit, cool. But it's like, the way he's presenting it is like this is something that can broadly be used across everyone, and therefore it's an argument as to why we need to interject all this spirituality Ayurveda shit into it, because, well, look, it works here when we're talking about osteoarthritis, which can be very severe, but often is the less severe form of arthritis that exists, right? Like compared to like rheumatoid arthritis or something like that. So yeah, I don't know, man. It just seems like it feels very much like this is using limited cherry-picked situations to try and paint a broader picture than is due to be painted or something, right?
Exercise. Does that make sense, or did I lose you there?
No, and I have to really dump things down in my mind for me to understand them, and I'm going to tell you how it's landing for me, and you tell me if it's accurate. When you put meaning into what you're doing, spirituality is a form of meaning, you get better outcomes.
I don't think that's it at all.
Oh.
Yeah.
Okay.
So I think that there are mechanisms at play. So let me try to explain it better. So
like that was my understanding too. And I think me and Dr. Mike, listen, if I was in the US and I was able to, Dr. Mike could be my doctor. He could sort my terrible state out, okay? But I think that's what I was getting to, is if it's magic, right? I'm doing magic exercise, in your head it feels better, okay? But then he presents that, and he's like, no. And he acts like there's some other essence that we can't perceive almost that adds to it, which is, to me, complete bullshit. But anyway, let's see his response.
We have a study. You can look at the paper. I'll send you the reference. So Tai Chi and osteoarthritis outperforms physical exercise. Okay, so now let's understand Tai Chi is based on this theory of vital life energy, which we have no scientific evidence for. So then the question becomes, how do we explain...
Dr. Mike can't sort your shit out, mate. He's a preventative doctor. Your damage is already done. True.
This result, that this practice, which is based on a non-real thing, outperforms a seemingly comparable practice. They're both just moving around. So there are two explanations for this. One, or probably more. One is that this thing does exist and is not measurable. The second is that even if it doesn't exist, the concept of this existing and something about the way that they developed those practices based on this concept, it's still just completely biological. But because we were considering Qi, we developed this different set of movements. And if you look at someone who just does stretching or calisthenics or whatever, these other physical practices, that there is a difference in the physical practice. Does that make sense?
Yeah, I mean, I could send a patient for physical therapy, and the physical therapist can target, like let's say someone has a low back strain, and I send them to physical therapy. They can focus on massage and movements of their thoracic spine and loosening that up. They can focus on glute strengthening and hamstring.
Well, what he's trying to argue is that, number one, it could be that it's Qi and it exists, we just can't measure it yet. Or two, well, they got to that place anyway, so there's value and benefit in it beyond just what seems to be more like a placebo effect, which seems to be being described, i.e. you perceive your exercise as having some magical essence, and therefore it makes you feel better, even though the physiological effect is no different. You feel better in your head because of it, right? That's what he's, That's my understanding of it, at least. He's trying to argue that, well, there's some benefit in that they found that, even if it's not physiological, beyond it being magic, it's good because it's Tai Chi, not just because it has a placebo-like effect, right? That's my understanding of it, at least.
String tightness and posterior chain strengthening, they're all movements, but they're going to yield radically different results.
Yeah, perfect, right? So that's what I'm saying, is that there's something about the theoretical, there's something about the theoretical backdrop that they developed, whether it's real or not real, that leads to a particular protocol, which...
Sure, I guess acupuncture works and makes people feel better. Well, that's like the fundamental problem, okay, with this kind of medicine is it's like acupuncture, I don't think has got any physiological aspect. It's self-reported symptoms that can feel better after acupuncture. And in fact, in some limited cases, I think that even the NHS may prescribe, it's an optional prescription for like, in addition to normal medicine normally. It's not just like go and get acupuncture for cancer. But like, but then what happens is you go to the acupuncturist, right? And it's like, what else are you going to be introduced to? What other pathways are you going to go down? You know, where you start to get introduced into that cycle, and you end up interacting with a bunch of, I mean, an NHS acupuncturist recommended is probably going to be okay, I would guess, right? But like, there's a bunch of people out there who want your fucking money, okay? And they will propose a bunch of shit to you to get money out of your pockets into theirs. And what are you being introduced to if you start to enter that alternative medicine cycle? It's not to say that everyone that engages with alternative medicine is going to die, but there are risks associated with, you know, entering that cycle, I think, and moving away from using Western, sorry, I keep saying that because I'm getting tricked by Dr. K. Like, when medicine that works, medicine that demonstrably works based on evidence, okay? Moving away from that and moving to more alternative therapies is obviously retarded. It needs to be at the very best quite complementary, I think, you know? But yeah.
Outperforms our understanding of exercise.
Right.
So I think that even if we assume that latter case, I think we could be losing something, because if we even remove that theory that gave us the practices in the first place, we could be depriving ourselves of a certain methodology that leads to interventions that are quite good. I don't know if I lost you there. This is the most technical conversation about this I've had in a long time.
This is great. I love this. It's a very heady conversation because we're talking about tertiary level concepts right now, of imaginary concepts. So where my mind is going is that you feel that the way Tai Chi was created, we shouldn't just focus on Tai Chi. We should focus on how Tai Chi was created, because there's value there.
Potentially, right?
Right.
Focus on in terms of investigation.
Right.
So what? Just to give you
what is it, dude? The amount of endless investigation all this shit needs, bro. It's whoa. We need to do more investigation on Tai Chi, guys. We need to do more. Why? It's insane. Constant. That is, dude, that is absolutely the sign of these quack freaks, is the constant call for more investigation.
Another example. So like I was, when I was at like McLean Hospital, I was developing protocols for specific pranayama or breathing practices to target specific illnesses. So if you look at the RCTs, what we see is RCTs on mindfulness. But if you look at what is the actual thing that people are doing, it's wildly different.
Of course.
And what we see is that in DBT, we'll call something mindfulness, but these are very different from mindfulness for like stress reduction. So for something like MBSR, these are open awareness techniques. And there's some great research that Silbersweig out of Brigham and Women's has done about sort of the different types of meditation. So not all mindfulness is the same. And what I've sort of found is that if you do traditional mindfulness for people with a history of trauma, it has the opposite effect. So traditional mindfulness is just open, non-judgmental awareness of the flow of your thoughts. If you have a patient who has BPD or trauma, and you just tell them to open awareness of non-judgmental...
No, not at all. Not at all. The point I'm making is some of this stuff has existed and been around for years, for thousands of years in some cases, okay? And then the scientific method has been applied repeatedly to a lot of these different methods and a lot of these different things. And it's been found wanting repeatedly, but yet they still call out, no, we need more. No, we need more. No, we need more. You've not done enough. More, 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 more.
Make sure to wipe first. both hands.
Thank you for the $5.
Appraisal of your thoughts. We have all these psychological defense mechanisms that are keeping these traumas at bay. As soon as that opens up, they're going to get overwhelmed by their trauma. So if you look at the mindfulness in something like dialectical behavioral therapy, these are not open awareness techniques. These are grounding techniques. These are things like ice diving, where you're not non-judgmentally observing anything. You are actually inducing a particular sensory focus that is so demanding that you can no longer think. So when we look at these two things now in Western science, we don't really have a good understanding of that differentiation. So I absolutely think we need that. What I'm saying is that when you take it from a theoretical process from where it was developed, and you sort of consider that, it gives us a lot of basically lead time into scientific investigation. Because when I'm developing a particular set of
downward-facing dog can cure rectal cancer.
Thank you very much for the super chat. 699, Mr. Queeb. Thank you.
breathing practices or meditative practices for anxiety versus depression versus trauma, I have this Eastern conception, which has this whole thing where they basically say this will work for anxiety, but they don't call it that. So they'll say, for example, this practice will slow down the thoughts in the mind. This practice will energize the prana. This practice will cool the prana. They use all these weird heuristics. And what I have observed in my clinical practice, so this is a small sample size. My path took me in a different direction. But what I was really working on is trying to see, okay, if we use this theory and we develop a set of protocols, this is basically what Marshall Linehan did with DBT in some form, we can actually accelerate the rate of our scientific research because we have these answers already here.
So where is the cultural misappropriation or appropriation come in that you have a problem with?
Yeah, so the moment that we remove that spirituality from it, I think we lose that value generating aspect. Right? So the moment
why do we have to lose that? Like, for example, you took the principles of those breathing practices of slow the mind or energize the mind, and you adapted them to modern medical defined conditions.
Yeah.
Why in this scenario do you feel like you're losing the spiritual connection?
Because when we publish papers about it, the more that I include...
The moment you remove the witch doctor from the ritual, it stops working. No, guys, this thing that I've got lots of weird connections to, it's essential that it's connected to it. We must keep it connected. We've got to. It's important. Why? Well, just because it is. Don't worry about that. Don't worry about my fucking connection with these Ayurveda organizations. It just, trust me, we must keep it connected. And I know for a fact, apropos of, I don't know, a study in 2016 that's the case.
Include that information, which is really where I got my answers from, right? The more that I include that, the less likely it is to be published. So because people don't publish that.
Why?
I don't know. Because it's not
hang on.
This conditions.
Yeah.
Why in this scenario do you feel like you're losing the spiritual connection?
Because when we publish papers about it, the more that I include that information, which is really where I got my answers from, right? The more that I include that, the less likely it is to be published. So
why they're not publishing my paper about how good chi is? What the fuck is going on? Listen, I've written a brilliant paper about how you can ground your chakras, and for some reason these fucking Western medicine don't want to pick it up. What's that about?
Which is really where I got my answers from, right? The more that I include that, the less likely it is to be published. So because people don't publish that.
Why?
I don't know. Because it's not scientific.
But the science mechanisms, theories are not scientific in nature.
Yeah.
So I could have a thought today that I would put up for scientific testing. How in the world would a company not want to publish something if something works simply because the beginnings of it weren't scientifically valuable?
If you look at the studies, the evidence-based studies, right? These are studies that are published. So if you look at like New England Journal of Medicine thing on Tai Chi, you'll find you'll see a small section in the background that Tai Chi is an ancient practice based on this theory. You won't have a single line about what is actually happening to the chi in your body when you do this kind of thing.
Correct.
I mean, if he's willing to say it's not scientific and it doesn't meet the scientific rigor that we've got in the West, fine, but like, I don't know, man. Listen, anyway, come on, we're nearly through this, and then I've got a fucking brilliant rate review lined up. Okay, I've got two, one that looks like it's actually got some merit, and another one that looks like bullshit. So we're going to get into some rate reviews after this. This was a very self-indulgent section. I appreciate that a lot of people probably aren't as interested in this stuff, but it is older drama that I got kind of involved in a couple of years ago, so I thought I'd catch up. And this has been great for me, and hopefully some of you are introduced to the absolute fucking insanity of Dr. K if you weren't before.
So there's a strong publication bias against this kind of stuff. I don't know why. I mean, you have to ask the
But
journal editors.
what is the value of including the history of it?
It's not history. What I'm talking about is they have a mechanism, right? So they have a theoretical mechanism with which they develop a practice. And we know from evidence RCTs that the practice is quite effective.
Okay, that's wonderful.
So what I'm
But
saying
how
is
do
that
I
the
make
moment that we
money
publish that
off
paper and
depressed
we
people?
Hey, Tizzy, thanks for the bits. The segment has refreshed my doshas. Okay.
remove the theoretical basis, it's kind of okay because we still see that Tai Chi works. There's other problems that we get into. But then what we're also doing is we're not, it's not about credit, but the way that this practice was developed was based on this theoretical model. And if we remove the theoretical model, we don't have that theoretical model to generate other practices or to work with that theoretical model. So let me put it this way. Let me give you an analogy. So let's say that there's a group of aliens and I introduce to them microbiology. And I say, here are the principles of microbiology. And then I give them, let's say, I don't know, penicillin, okay? So if I do an RCT on penicillin, I say penicillin is great, but by the way, microbiology is all BS. We just can study penicillin. We know penicillin works. And then this alien civilization starts just delivering penicillin because they don't understand anything about microbiology. What are the problems in that? We have an RCT that penicillin works, and then we give them, and they start administering penicillin. What's the problem?
Resistance?
Absolutely. Right? So this is one example where understanding the underlying theory becomes very important for the implementation of the practice.
But he's talking about stuff which is demonstrably physiological, of like the resistance of penicillin. Is that what he's talking about? The resistance of penicillin? I think what he's trying to do, this guy is very, I mean, listen, I'm a retard. I mean, this guy is probably, the doctor seems to be a bit fucking hard pressed at times. I'm pretty sure what he's trying to say is you need to include the mechanism of microbiology to understand why penicillin works. But then I guess the difference is that there's a scientific method that you can apply that proves the evidence of how microbiology works that doesn't exist with this chi thing, right? I think is the problem there, I guess. Let's see how he responds.
Practice. And what we are losing in Western medicine is we are removing that underlying theory, which opens us up to different perspective problems. And antibiotic resistance is just a good example, right? So that was like, I knew what you were going to say. I knew what the answer was. That's why I picked that example. So it's not sufficient to just do an RCT because there are other principles at play, and there are RCTs involved in those principles. We have RCTs on antibiotic resistance, but that's where understanding the theoretical basis of our treatments becomes critical to avoid pitfalls like this. And what
Can you give me an example of something like that within the field of Ayurvedic medicine or spirituality?
Yeah. So, man, this is where things get fun. So let me ask you this. Where do the thoughts in your mind come from?
I don't know if I have the answer to that.
What do you think?
Neurons, blood flow, firing, creating action potentials.
Okay. So neurons, blood flow, firing, creating action potentials are all the same, right? Like okay, so you having a thought right now?
Yeah.
Where's that thought coming from?
My brain.
Okay. But is there any other thing in the causal chain that is creating that thought?
Is there anything else in the causal chain creating the thought? Sensation, receptors, etc.
Right. So
nerves.
The simple idea. So one of the places that thoughts in our brain come from, this is based on the yogic concept. So sure, it's translated through the brain, but we know that our sense organs are a source of thought.
Yes, he just tickled his foot. Correct.
So this is why advertising is a thing. If I show something to your eyes over and over and over again, it will trigger certain thoughts. It will trigger certain desires. Agreed? Okay. So where else do thoughts come from? So we can also have thoughts. So I'll speed run this. You're welcome to question it.
Memories, etc.
Yeah, so memories of sensory experiences. So how do I want a hamburger? So later tonight when you're relaxing at home, you're going to be thinking to yourself, man, I wish Dr. K would touch my toes again. Right? And so where does that thought come from? That thought comes from a memory. So we can have thoughts sometimes come from sensory impressions and sometimes come from memories. We can also think about something like studying, right? So I'm asking you questions, you're asking me questions. Where does this information come from? It comes from our memories. So let's take someone like anxiety, or someone who has anxiety, or someone who has something like trauma. So these people literally.
Yeah, honestly, like, what did he ask him? I've forgotten the question even. What did he ask him? What is something from Ayurveda? Like, is this answering his question?
Okay, that's wonderful. But how do I make money off depressed people?
Shah and I used to make pizzas. Once he turned up blazed and I asked him to roll some dough. 5 minutes in, his dough ball became too big, prompting me to scream enough dosha. Enough dosha. What is dosha? What is dosha?
Thank you very much for the 20 English pounds. Appreciate it.
literally have thoughts in their brain, they have, let's say, low self-esteem. But what does low self-esteem mean? There's a mechanism of low self-esteem. It is, maybe there's activation of the default mode network. We understand the neurology of this, but from an experiential standpoint, there is something in their, let's call it subconscious mind, I can go into more detail if you want, that generates low self-esteem thoughts. So if someone gets me a nice gift, my mind will, this is a sensory input, right? So I hand you a gift, you hand me a gift. Your mind can say, oh, this is wonderful, this is great, thank you so much. Someone else's mind can say, oh, I don't deserve this.
Hey!
Right?
But how do I make money off depressed
Jay
people?
Meta, thank you for the 10
Cannonball
gifted
became a
memberships.
member.
Very generous of you. Thank you. Oh my goodness, you guys are too kind. Thank you.
Okay, that's wonderful. But how do I make money off depressed people?
Clayman became a member.
Thank you. Thank you. Thank you. Thank you. Thank you. Appreciate it.
Okay, that's wonderful. But how do I make money off depressed people?
Laskin became a member.
In
Okay,
fact,
that's wonderful.
guys,
But
I
how do
thought I was
make
going to get through
money
this, but my
off
dosha
depressed
has
people?
gone right through
Super
me.
Saiyan Solid Snp became a member.
My dosha's gone through me and it's in my balls. And piss comes from the
Okay,
piss is
that's
stored in the
wonderful.
balls,
But how do I
according
make
to my
money off
it's
depressed
my
people?
science.
Gene became a member.
So I need to go and release my ball piss immediately. All right?
Okay, that's wonderful. But how do I make money off depressed people?
Politics became a
Discount
member.
drama YouTuber attempts to bash tipster live. Oh, dude!
That's wonderful.
This Alec Gunter
But
guy
how
is
do I make
totally
money
clueless,
off
man.
Because Tipster is a pretty big streamer. He's been around for a long time on the internet. And if you guys didn't know,
Dude! Oh, man! He doesn't know! He doesn't know!
And like in a genuine way, like he's being serious. He's not even playing into it.
Trash
He's like,
Cat
oh, I actually
became
can't
a
see my.
member.
It's literally just, well, yeah? Look at your hair and your jacket. Okay?
I get f***ed in the ass in private. Wait, dude, he
Dumb
said,
Buckets
True.
became a
He said,
member.
welcome to the adult space. I'm gonna treat you like an adult. And proceeds to talk about my asshole.
Okay, that's wonderful. But how do I make money off depressed people?
Hero and became a member.
So, let's have a look at this lyric stuff. So, for those of you who don't know, this Alec
that's
Gunter guy made
wonderful.
some weird
But how
comments
do I
about
make
lyrics. So,
money off
what's
depressed
happened
people?
is, very
Dr. Mike
simply,
interrupts Dr. K
this
and
Alec
says,
Gunter
"Who
guy
cares?
is like friends with
You
Tipster
killed
now.
Rockful and then
Okay, there's
cried
a
like
conversation
little
they've had
girl on
together.
stream.
And I think that
Dr. K
Alec
then
Gunter
puts
has
Sadosha being
swerved his
exposed.
kind of chud dunking.
Okay, that's wonderful.
And is
But
trying
how
to do
do I
that
make
same
money
kind
off
of
depressed
style of
people?
content
Maybe instead of
on the
paying my
commentary,
cancer
guys.
center
So he's kind of
over
brought that
$1
energy to
million
lyrics.
treat my cancer,
But it just
I
comes
should have
across
paid
as
this
kind
guy
of
to
weird
meditate the cancer
to
away.
like talk about lyrics like that. Because, you know, lyrics, I mean, it's weird to talk about someone like that anyway, right? But particularly with lyrics, like lyrics isn't really the kind of guy that I would have thought you'd think that kind of thing about because he's not like that, you know? Very fucking weird. Anyway, lyrics has responded. So let's see. Now,
Hello. Let's get right into it.
the title of lyrics' stream is I've been victimized, Rape News Network Live. So we're gonna allow Lyrics to put his own spin on this. This is his story. Okay, we're not gonna do the rape review intro. We're gonna let him speak his truth via his own narrative and rape network.
Ladies and gentlemen, there hasn't been a ton of stuff.
Right, guys, come on, let's power through this. I really want to get to the rape. Got another energy drink as well. Do you know what? I'm so stupid. Remind me at the end of my stream, I need to turn off my 6:30 alarm, okay? Oops. I need to turn off my 6:30 alarm because do you know what time I woke up this morning? 6:30. 6:20 in fact, because for some reason I decided to leave my alarm on from a few days ago. And I did the same
Okay,
thing
that's
yesterday.
wonderful. But how do I
Stupid.
make money
Hey!
off depressed people?
Filling up your
Malkaz.
dosha with my bits.
Thank you for the bits. Anyway, guys, to
Okay,
anyone with
that's
any
wonderful.
doubt,
But how do I make money off depressed people?
from Mushrooms Button, thank you for the £2. Malkaz, thank you for the bits. Let's do a quick super chat check whilst I'm here. Let's have a little look at super chats. Absolute nonsense. Maybe instead of paying my cancer center over $1 million to treat my cancer, I should have paid this guy to meditate the cancer away. Thank you for the £10. And PD, Dr. Mike interrupts Dr. K and says, "Who cares? You killed Wreckful and then cried like a little girl on stream." Okay. Thank you for the $5 Canadian. Dr. K then poops a dosha being exposed. Thank you very much. Appreciate that. I disavow. Thank you.
The thought is coming from somewhere. So along comes Yoga Nidra. And what the yogis basically discovered is that the more empty your or non-active your mind is, the less activity that is in your mind, the deeper something will sink into your mind. Does that make sense?
Well, I don't know what deeper into your mind means.
I'll give you a simple example. So let's say you're studying for
yes, it's the bombsicle
test,
one,
right? So your licensing exam,
Strong
and you're
recommend.
in your, let's say you're looking at a textbook. The more activity is in your mind, if you're thinking about this, let's say the library's on fire, there's going to be so much mental activity that what you are trying to absorb does not sink in. It doesn't enter your mind. It kind of bounces off. So you have to read the page again.
Attention is not there.
Yes, attention is not there. So the
retention.
Retention and attention.
Yeah.
So one-pointedness of attention correlates with retention. Okay, agreed?
Yeah.
Okay. So now enter non-sleep deep rest. So this is a practice originally called yoga nidra. Now people are doing studies on it, lowers your cortisol level, all this good stuff, right? All these physiologic parameters. But the whole point of yoga nidra is not to do any of these things. The whole point of yoga nidra is to enter into such a state of rest. That's not the point of the practice, that's the prep. And then to implant thoughts into deep into your mind so that they generate into your conscious mind. So what I mean by that is you take something called a sankalpa or a resolve. So whatever sankalpa you use during yoga nidra gets implanted into your mind and then starts populating your mind during your regular time. So when I use this with patients, for example, who have a history of trauma and have self-esteem problems, so like, we came up with one sankalpa, which is like, I deserve to be whole. So it's not that I am a good person, I'm going to manifest things in the universe, and there's interesting science on manifestation and stuff, which we can get to, but, and it's just this idea that if you literally look at...
Jesus Christ. No wonder there were so many fucking massacres during imperialism. If this is what we had to deal with, my ancestors had to deal with. Rock up to some fucking foreign country and there's a bunch of, people coming up to you. Blah, 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 blah. Just fucking pull out the sword, pull out the fucking musket, pull out the fucking Henry Martin rifle. Straight through the chest.
A patient who is struggling, their mind will have 100 thoughts over the course of the hour. And there is a particular practice that allows us to add 10 thoughts of whatever we want. So this is sort of the spiritual value.
Okay, we're nearly through this. We've got another little bit here. What, 10 minutes or so? 20 minutes? But there's no more Dark Viper stuff. I covered the extra Dark Viper stuff today. But Alanar, who is, I very much appreciate their words on this stuff, sent me this. Watch this video. This was not uploaded by the woman featured in the video. Do you think the woman would have the right to take it down if she wanted? Yes, since it's just that. So this is the Sargon of Akkad. Aquila, obviously, famously determined to be fair use, right? Yes, since it's just an upload of them, what I'm guessing of her, 2 clips of her, nothing was changed about either of them. Links to the case, which goes over the decision, which found in Sargon of Akkad's favor that it was fair use, even though Sargon of Akkad only used clips of this person content stitched together. And this person responds, court is obviously wrong. Like, these people are so fucking parasocially attached to Dark Viper's cock, okay, that they are disagreeing with court decisions now and are claiming that a court is wrong. That, one of the most, a case that contributed to understanding about fair use. Two clips added together is so obviously not transformative. Whether or not a dumb court said it does not matter. Right? They know more than judges now. They think they know more than judges. Alanar, true. Why doesn't Chud take it to court to prove his case? They wouldn't believe it if you did. True. Very true. Very true. Jesus Christ, man.
Of a sankalp, and even there's even more even psychological benefits to it. There's spiritual benefits and transcendental benefits and all this kind of stuff, which is really what a sankalp is about. But the point is that when we just do non-sleep deep rest, you can look at all the studies on that. No one's going to say anything about a sankalp.
Dark Viper cites the Klein case too, and they used basically the entirety of Hoss's video. I thought they argue that that wasn't the case and that they only use selected clips and stuff. Yeah. I thought, isn't that what they say? Or is that not true? Did they use quite a bit of it? Because that's the other thing about fair use is even if you only take a portion, if you take the central point or the heart of the work, that can work against you too. And yeah, I mean, all of it. Listen, I'm look. At the end of the day, it's such a boring conversation. The funny thing about it is, people are bored of the kind of react shit anyway, right? They're bored of the conversation about it, and a lot of people have moved on, and I think it's why it just doesn't generate that much kind of interest necessarily. But the funny part is that Dark Viper is now spurred so much that all this other fucking attention is on him. Like the Carl Jobs thing. The Carl Jobs thing happened as a result of him continuing to fucking argue with, as Carl Jobs puts it, haters on the internet, you know? No one cares because everyone Dark Viper thinks it's okay. Yeah, of course. Yeah. And his fans. Don't forget about his retarded fan base.
But when you do the practice the way it was designed to be done and you add something like a Sankalp, from a Western standpoint, there may be some kind of auto-suggestion or something like that, some kind of cognitive reframing. We're not quite sure what the mechanism is, but there's something to put your state of mind into something that is like a hypnotic state of mind. And then whatever you implant generates thoughts. So when I do this practice in my clinical practice, which by the way, I usually do proper informed consent with my patients. I say, here's what the science shows. I spent 7 years in India. This is what I'd like to try with you. Here's what I think will happen, but there's no data to support that. So I go through all that with all my patients. And what I find is that there is immense therapeutic.
Wait, didn't he say earlier that he doesn't implement it in his practice? Am I misunderstanding? I thought it was earlier he said he doesn't implement it in his practice, but now it seems like he does, but he gets informed consent, apparently. Okay.
Value in adding the Sankalp. That's an example.
Mm-hmm. And modern science doesn't yet do
in the majority. No. Okay.
And why do you think they don't?
Because it's spiritual in nature. Well, 2 reasons. One is because it's spiritual and there's no basis for it, right? There's no mechanism to understand what a Sankalp is. So it just gets removed from... literally what happens is you'll get people who will study this stuff and then they'll remove all the spiritual woo-woo for it because we don't have a mechanism for it. Mm-hmm. Because really what a Sankalp is about is not the psychological manifestation. It's even an external manifestation or a spiritual manifestation.
In Western medicine, now that we've proven this non-sleep deep rest has some benefits, that's step 1. Wouldn't then be step 2 testing whether or not adding the Sankalp?
Absolutely. So that's what I said. There's 2 reasons for that. One is, and this is why I think it's a double-edged sword. So if you look at something like mindfulness, I think we've lost a whole lot, but it is a absolutely necessary step. Mm-hmm. Because without the discovery of mindfulness and the protocolization and the removal of the spirituality, you've got this guru who's doing this mantra over here, you've got this guru who's doing this, you've got transcendental meditation. So now we have a research problem, right? Which all these people are doing different things. What is responsible for the therapeutic change that we see in transcendental meditation or this kind of meditation or this kind of meditation? Yeah. So we have to distill it down to some kind of protocol and then we grow from there. Mm-hmm. So that is literally what the work that I try to do. Mm-hmm. And at the same time, what I notice is that while that work is being done in my clinical practice, if I lean on just non-sleep deep rest in terms of instead of yoga nidra, what I find is a lack of, I'm leaving something behind clinically. Mm-hmm. But I think it's the way that we have to do it.
What is your read on this Dr. Mike guy here? What do you think he's thinking here? He's trying to be polite. It just comes across like it feels like he thinks this guy's a fucking nutter. He's just a bit like trying to be nice about it.
I think you and I see eye to eye on this topic really pretty much 1-to-1, maybe 99.9% of the way.
I think we see eye to eye on Ayurvedic stuff almost.
No. Yeah, that's what I'm saying.
No, he's being too nice. No.
Really, really close. My question is, when you're doing that practice and you're doing the informed consent, and you're doing it before the evidence hasn't caught up to it yet, how would you feel if when you, let's say, a patient comes into a doctor's office and the doctor says, hey, look, this medicine has never been proven to work for your condition through scientific rigor, but I'm going to give it to you anyway. Just trust me. Do you have an issue with that?
What do you mean by issue?
Do you think that's ethical?
What? What do you mean by issue? This guy's supposed to be... What do you mean? It's obvious that's fucked up and wrong and you shouldn't do that, no? Just trust me, bro. What's the issue with that? Like, bro, they're so obvious and transparent. The issue is he's saying, trust me, bro, because you're not giving enough information for someone to make informed consent.
Proven to patient comes into a doctor's office and the doctor says, hey, look, this medicine has never been proven to work for your condition through scientific rigor, but I'm going to give it to you anyway. Just trust me. Do you have an issue with that?
What do you mean by issue?
Do you think that's ethical? Because you can go down the line and say there is off-label prescription. Yes, there is.
No, so here's a fascinating study by a guy named Ted Kapchuk.
Oh! Dude, that's the easiest fucking thing in the world. No, that's not ethical because you're not allowing them to have informed consent. You're not giving them enough information, bro. What?
And say there is off-label prescription. Yes, there is.
No, so here's a fascinating study by a guy named Ted Kapchuk. So he's a placebo researcher out at Harvard and was a mentor to my PI. So he did a super interesting placebo study. He said, I'm going to give you a placebo.
He's being too nice. He's not getting him to answer the. That is a yes or no question. Is that ethical? Yes or no? That answer. That should be it. And then you can elaborate if you want. Dude, this is what this guy does. He throws out a little. Oh, there's this study here. There's this study there. To obfuscate. Dude, he's a quack. He's a fucking quack, bro. And it's so obvious to everyone, but for some reason, some people fucking act like he's not, and he is.
This is a placebo, but we know that placebos work.
Mm-hmm.
And he said, I think this will help you. And turns out that the placebo helps, even if people know it's a placebo.
Sure.
So I think that, off-label prescribing, as long as you do it with informed consent and the doctor has some kind of rationale behind why they're prescribing it, I think that's reasonable.
So what is your rationale for adding the sun kip? Sorry, I'm saying it wrong probably.
So I have some...
But the thing is, oh my God, this Dr. Mike's done a great job. And I think he doesn't want to be too combative. And I think when Dr. K called him out for being like that, I think he's maybe tried to change tact a little bit. But that's not informed consent, is it? That's not what informed consent is, because you're saying, trust me, bro. That's not informed consent. Informed consent would be explaining, not just like, oh, it hasn't worked for your condition. It would be explaining the logic and why you think it might work and all the fucking shit about it or something like that, you know? Not just, trust me, bro. Anyway, let's get through this.
And I also believe that, like I'm kind of saying, some of the roots have value. So then what I'll do is I'll even explain to my patients. I'm pretty clear about, this is what the data shows. So this technique will absolutely be in line with what we understand is the evidence-based practice of mindfulness. Based on my spiritual training, there is an additional component which, if you're interested in, we can do. Secondly, here are the 2 or 3, I've seen this to be very effective. Here are the mechanisms that I would hypothesize from a Western standpoint. Here's what I think could be going on with neuroscience, with this. And then I'll put it to the patient and let them decide.
Right. Aren't you just giving them a placebo and calling it a placebo by doing that?
What is a placebo?
You're giving them something that is unproven so far by our Western methods and saying there's no evidence for it. So you're saying it's a placebo. You're admitting that to them, to the patient. But you're saying you think it would help.
What is a placebo? How would you define it?
To me, the description of placebo is something that we do not feel like would help the patient through a mechanism by which we understand.
Yeah. So here's how I would describe placebo. Placebo is things that work that we just...
Wait, sorry. I got distracted. Sorry.
No evidence for it. So you're saying it's doing that?
Signs with this. And then I'll put it to the patient and let them decide.
Right. Aren't you just giving them a placebo and calling it a placebo by doing that?
What is a placebo?
You're giving them something that is unproven so far by our Western methods and saying there's no evidence for it. So you're saying it's a placebo. You're admitting that to them, to the patient. But you're saying you think it would help.
What is a placebo? How would you define it?
To me, the description of placebo is something that we do not feel like would help the patient through a mechanism by which we understand.
Yeah. So here's how I would describe placebo. Placebo is things that work that we just don't have mechanisms for.
Common bullshit stall tactic. Yes, 100%.
That's what, yeah.
Yeah. Right. So, and that's where I would say, here is the hypothesized mechanism, but I think we have to do it. I wouldn't call it a placebo, but you could absolutely make the argument that you are engendering the placebo effect. But I think that is absolutely necessary. You have to do that, right? Because if we're talking about ethics, you can recommend things that are off-label that we may not understand the mechanism for. That's actually okay. So whether you call it placebo or off-label prescribing, I think it's somewhere in there. Are people engendering the placebo effect? Almost.
But wait, no. But I thought that off-label prescribing meant that there is some evidence that demonstrates it might work for that condition, but not that, I thought a placebo is something where it's like, it's not that you don't understand it. It's that it's something which you're set, dude. It's not the same as a placebo because you're saying, well, this treats A condition. There's some evidence that suggests it might treat B condition and it might help you, but we're not 100% on that. But it's an option if you want to try it. And, you know, let me explain the side effects, da-da-da. I thought that was an off-label fucking prescription. And then a placebo is something which has got no physiological impact. But you're saying, yet that we understand it. But no, a placebo is in, you recognize that there's no physiological impact that's going to be given by this thing, but you're giving it to them. And them thinking that it has an impact has some impact on some self-reported health concern or something, right?
Certainly. And this is where there's even I'm in a worse position for this, to kind of support your point, which is that there's a huge selection bias of people who come to my practice. Mm-hmm. So people who come to my practice are looking for, they already have a preset idea of, okay, this guy's going to teach me something special. I give something special. It fulfills their expectation.
What do you reckon he wears at his practice? What do you reckon he comes out? What garb does he come out in when he meets patients for the first time?
And they see a clinical benefit. The clinical benefit is, the reason people come to me is because people who've been to 10 psychiatrists before, I'm not trying to toot my own horn or anything, a lot of people will come to me and they've tried other things. I mean, I even started a consult service at MGH where the majority of my patients were from other psychiatrists because they wanted to learn this stuff. So there's even a selection bias, which I absolutely have to consider. My take, though, is that there is a very real mechanism to this. So I don't think, and that could still be placebo.
My question is, how do you you're so honest with this, and I love this. So I have to give you huge props to this because I can't tell you how many doctors will claim I've helped 10,000 people, and I'm like, but selection, like the people who are coming to you.
No, I have a bigger placebo problem than the average person.
So that's amazing that you're like taking that into consideration.
Terrifies me, Mike.
So now the question is, how do you decide or decipher between what you're doing being truly beneficial versus is this a placebo effect, or does it not matter?
So I can't decipher.
And does it matter? Is it important to decipher?
In a theoretical perspective, absolutely.
So, how would we get there?
So that's where
Oh, did I get raided by Lonerbox? Hey, Lonerbox. Sorry, I didn't see that. Welcome, Raiders. Welcome. Welcome. We are just being racist about Indian medicine. Thanks for the raid. Guys, we're near the end of this segment, so if you just join in, we're going to be getting into a rape review next, and we've got two. We've got one brony that's been accused of grooming, okay? And then we've also got a second one, which is apparently bullshit, but we'll see.
I'm trying to do, so before this whole healthy gamer thing, I was trying to develop clinical protocols for specific meditation regimens for particular diagnoses. Right? So we'll have studies on mindfulness for anxiety and mindfulness for depression. But my whole belief is if you have an energizing pranayam, these people who figured this mindfulness crap out also had other things that they figured out. And they said certain kinds of breathing practices are energizing. And we even have some physiologic evidence of the support of this. And this is why I do it, basically, because we know that some breathing practices will activate your sympathetic nervous system. Some practices will activate your parasympathetic nervous system. And oh shit, they seem to have figured that out. So then when I look at that, I think that, okay, so here's kind of where I am, which is like, okay, this much is correct. Oh, it's interesting. There's like some stuff that's correct here. One really fascinating thing, I was talking to a cardiologist who teaches pranayama. And I was asking him, like, you know, what do you think about this stuff? Because you're a cardiologist. This is back before I was in med school.
And
so he said,
describe placebo. Placebo
hey,
is things that work that we just don't have mechanisms.
Thank you for the $5.
Oh, like, I think this stuff works really well. And he says that the particular practices that maybe even you can figure this out, you know, practices that I do involve very low respiratory rates. So if I have a very low respiratory rate, what does that do to my
parasympathetic nervous system?
Can activate parasympathetic nervous system. So we're dropping our O2 levels. We're increasing our CO2 levels. You're practicing this for a long period of time. What his observation is that when he has patients who do pranayam and they induce transient low O2 levels and high CO2 levels for extended periods of time over the course of years, that when he ends up doing bypass surgery on them, they have a lot more collateral circulation around the heart.
You Yanks actually pay real money to be treated with... Honestly, I reckon that there's some sort of weird thing in America. Not all Americans. Some Americans are based, and I'm sure some people that are saying based things agree with, you know, the non-retarded takes on this. But I think because you have to pay for healthcare, it's twisted your melons. And I think some people get totally fucking insane about shit. Hey, John Sanchez, thanks for the $3 super sticker. Pair character stretching his arm forward, raising his thumb up. Base, thank you. And I think that you do have like health authorities in America, but it's obviously extremely federalized and stuff, right? And I mean, in different states, you can get different shit going on or something as well. But I don't know. I feel like having a centralized health authority of like strength and rigor, like the NHS say, is beneficial. And like, generally speaking, if you want to know what's what with health, you go to the NHS and that's where you go. And I think that in America, there isn't a kind of centralized health thing like that. There's obviously websites you can go to, but the NHS being responsible for so much health affairs, I think is very beneficial because, you know, there's a lot of connected moving parts that mean that information gets out and stuff, and you have health campaigns and shit, you know? But yeah.
So he believes that the mechanism through which pranayama protects against heart attacks, transient O2, oh crap, our blood vessels, our vasculature around the heart is like...
No. I'm not saying British people don't fall for it, okay? I feel this is a feels-based thing. I feel like the CDC, I think there's a lot more distrust of the CDC, and there isn't, but the CDC is not like the NHS. The CDC is quite...
that's wonderful. But how do I make
narrow in what it
money
deals
off
with.
depressed
Like, it's a
people?
Centre for Disease Control, right? It doesn't have the overall health stuff.
Now that Q has realized that destiny is an infidel.
Thank you for the $10. I've got no plans to, but thank you very much for the $10. Appreciate it. So yeah, I think there's like departments that have got quite a narrow focus, but with the NHS, it covers a whole bunch of stuff. So I think that because it's more broad, I think that, and there's a lot more trust in the NHS. Like, for example, in the UK, even right-wing parties, even like libertarian right-wingers in the Conservative Party, know that they can't fuck with the NHS because the NHS is like loved. Even by old Conservative voters, they love the fact that they're going to get the fucking gammy knee treated or whatever, right? So yeah, I don't know. I think that like the lack of a centralized health authority is probably contributes to some of these weirdo health perspectives that some people have in the US. But I don't know. There's stats and stuff on this. It's just a feeling, okay?
Running out of O2, we need collaterals.
Of course, yeah.
Right? So physiologically inducing collateral circulation.
Neovascularization.
Yes.
Okay.
Right? By transiently decreasing O2.
Acute stress a lot of times yields great outcomes for the human body. That's
So that's where it's acute stress in a controlled and safe way that doesn't tip you past to the point of what your heart can't handle.
Correct.
Right? So I think that I've seen enough mechanistic support to where I think that this is not just what we call placebo, but then the flip side is placebo just mechanisms that we don't understand yet?
Well, yeah.
Right?
It can be.
Yeah. So I think that for me, it's fine. So the other thing for me is that I think informed consent is very important. I think letting people know what is scientifically supported and what is very important. The other thing that I personally feel, so here's, I think, one thing that we haven't really gotten to, because you're like, why don't we do research? Why don't we do research on it? Here's why I don't do it, or why I haven't done it. So I have a sense of desperation. So like, especially when it comes to Healthy Gamer and like all this stuff on video game addiction, it's like, so I got 2 amazing job offers from 2 just amazing people. And, you know, one of them was like, here's the academic track at Harvard Medical School. And like, you're going to apply for this grant and this grant and this grant. And 10 years from now, 15 years from now, you're going to be the guy. And this is amazing. It's beautiful. I had such amazing mentors who were so kind to give me this opportunity. In the back of my mind, I was thinking, what happens to all the people who are struggling over the course of those 10 years? Right? So what really bothers me about it as a clinician is that, like, it's fine that I think we should do all this research, and you're absolutely correct. I agree with you 100% that we start by studying the basics, and then
yeah, there's a very much like a savior complex. It feels like there, right? No, is anyone else picking up? You know, I need to go and help all these people.
We study the next mechanism, and then we study the next mechanism, and eventually we elucidate all of these Eastern principles and what are the biological mechanisms. Can we discover something like prana or chi? But here's the question: is what happens to the people in the meantime? How much time will that take? And I don't think it's an either or. I think we need to do both. It's just, for me personally, I find a lot more value, enjoyment, and I think that, like, I just worry about my patients. I worry about all these people who are addicted to video games, or all these people who are being loaded up with like psychotropic medications. And I think medication is good. I'm not anti-medication. But I do think that there are other mechanisms that we can harness that will impact someone's life this year, this month.
Where does that come from you?
That's an interesting question. So I think part of it comes from my own understanding or my own experience of how much a month, 3 months, or a year.
Anyway, listen, guys, dude, if you want to watch the, I need to move on, man. I've been covering this for hours. I wanted to do a rate review, but yeah, look, I hands up. I don't like this guy. I think beyond any other criticism about this guy, I think he's a complete shill for Ayurveda. And, you know, if you're not familiar with this guy, or even if you are, hopefully you've watched this and maybe realized he's a bit of a fucking quack as far as I'm concerned with this shit.